Hi, my name is Jay Blas Jacob Cabrera. I'm with Stop Coronavirus Global, project of the FCON Community Network. And this video is extremely important for everyone to watch. You need to know what's going on with the coronavirus. You need to understand that our governments are not giving us the correct information at this time. And we need to protect ourselves. We need to protect our loved ones. We need to protect our businesses. And we need to protect our communities when governments are not doing it for us. And we need to put pressure on our governments to ensure that they are doing what is needed to be done to protect and save millions of lives. The most typical response is what we call a mitigation model, a mitigation response, which is to, when there's a lack of forward thinking, we call it a failure of imagination to prepare and make sure that the virus doesn't take hold in a community. The immediate reaction is to lock down or do stay-at-home orders where everybody's told to stay home. The problem is that it's not a quarantine. People still are going outside. They're still interacting. And they're still spreading the virus. It does slow the virus down, but it's simply not enough to stop the coronavirus globally. So our focus is how specifically and scientifically to stop the coronavirus, and it's called a suppression technique. It's the same model that was done in China as well as South Korea, Taiwan, Hong Kong, Singapore, and other Asian nations. And we will go through all of the data and all of the details to make sure you understand exactly how it's applicable to your community, because you need to know this information. This is the foundation to your own life, your family's lives, and your community's lives, because it is a life or death situation. The two most important things you need to understand is one, that the science is coming out from locations where they are testing everybody, right? That 50% of the people who are infected do not have symptoms. So when they tell you that it's okay to just wash your hands and to, cover your mouth, right, when you're coughing and sneezing, it's not correct information, because half of the population who gets the virus is asymptomatic. So what that means is that when you go out to the grocery store to get food for your family, or you go on a walk, or you're basically in public interacting at a pharmacy getting your medicine, it is putting your life and your community's life at danger if our culture and our government leaders are not stopping the spread of the virus. So what that means is that you need to be covering, everybody needs to be covering their mouth and their nose with anything, right? You don't have a mask, do a tissue. Use pretty much like a cloth, or whatever you can. Every country is going to be different to what materials they have available. But the point is that we need to get over this idea that the virus does not spread from basic normal interaction in our communities. So the other information that's important to understand about specifically the spread of the virus is that if half the cases are unnoticed and asymptomatic, then the spread of the virus is increasing that much faster. We just don't know it because most of the people are asymptomatic and don't have symptoms. So, in the context of how to address that, we need to all be covering our nose and our mouths whenever we go in public. I think a good example of that would be the AIDS pandemic and the AIDS epidemic of globally, where 1 million people die each year still. There's two options. One, you can not have sex and not spread the virus, and so that would be doing abstinence. And the other option is to wear a condom to not spread the virus, right? So in the context that's very, very similar to the coronavirus, we have a lot of people who have the virus who don't know they have it and are spreading it, right? So the way you stop the spread is abstinence or covering, just like with HIV and AIDS. The abstinence is staying home, right? When you stay home, you don't go in public, you are preventing the virus from spreading. right? Whether you think you have it or not, right? The other option is when you do go out in public, you cover your your mouth and your nose. And basically, there are studies that are showing that this is not a normal flu droplet. Like droplets are the wrong terminology that are, sneezed and coughed. We're talking about more of like an aerosol, right? It's like vapor, like water vapors, where just talking and just, interacting and breathing near people, you're spreading the virus, right? It does not take coughing and sneezing in order to spreading this virus. That the science is simply just not there, right? So yes, in past situations with flus and influenza, that has been the case, but in this situation, there is no scientific evidence that says that this can't spread through simply talking, and that it is more of like an aerosol that actually hangs in the air. What that means is anytime you go indoors, you need to be covering your face and your mouth. Otherwise, you are not caring for the lives of yourself and your family and your loved ones. All right, so beyond that, there's some other exciting news for sure. But before we go into the other news, let's just get a general context of what the situation is across the world. So if you take a look at the cases since January 1st, basically the beginning of the year, you'll see obviously it really took off in China at first. But what you need to understand is China on February, like started, early February, about 2 months after it, took hold. And February 13th, right, was the climax for China's spread. And if you compare the colors here, I get, between 50 and 100 new cases per day. And that is very, very low compared to what we're dealing with now. So China not only was able to suppress the coronavirus and stop it, right? They did so in a manner that was much, much more effective than is being done in Europe and North America and other places across the world. So as you continue, you can see that China goes down and disappears and is no longer a hotbed. And you can see Taiwan pops up a little bit there. All right, so you see Taiwan popping up a little bit. Oh no, this is South Korea, right? So South Korea pops up right there, and then you can see how South Korea, as Italy and Europe is starting to increase, South Korea goes down and then disappears. So basically, you have all of these countries in Asia getting really bad exponential growth, getting really bad, primarily China and South Korea, and then they get rid of it. They stop the virus and they end it, right? It's a suppression model. It's scientifically proven. It's possible to do, and it's not what's being done in Europe and Americas. So if you keep going, you can see Europe just takes off, and you can see Italy's getting out of control. Iceland's a very interesting case because Iceland is really getting a lot of testing, and I think we just covered that. Basically in Iceland, they're testing everybody. So they're getting a lot more cases. They're almost getting twice as many cases because they're saying 50% of the cases are asymptomatic. So that's part of why you see so many cases in Iceland per capita. But it's still important to notice and see here that when China had its problems, there was only one day where they're in the purple. One single day, right? And now you look at here and you go into Europe and Iran and the United States, and it's day after day after day after day after week of disaster. And there's no end in sight. And the bottom line is if you use the suppression technique instead of the mitigation model, we're going to go over it in detail, you stop the virus in about 2 weeks. It takes 2 weeks to stop the virus. When you have exponential growth, right, if you stop the virus, you have exponential collapse. And that's what happened in China and South Korea. So, and in other places, including Singapore, Taiwan, other places, they really kept it from getting out of control to begin with. All of the new cases in China are 100% from foreign people coming back, or like people coming from foreign countries back into the country, into China. So there is a lot to be learned from China. There's a lot to be learned from South Korea. And the only other thing I'll say right now is that when anyone says that, oh, we could never do what they did in China, that it's too draconian, da da da, it's a false statement. What was done in China had never been done anywhere in the world, including China, until now. And furthermore, the idea that China rips people away from their families, the United States rips people away from their families too, right? So that's not any excuse. There's other countries ripping people away from their families, and the idea that China did that, without a cause, right? Saving millions of people's lives is good. And I don't think they really rip people out of their families in the context that you think about. It's basically families were not allowed to isolate in apartment complexes. They had to go to isolation centers to stop the spread of the virus. So they were not allowed to stay in their apartments, and they were told to leave. There are tons and tons of evictions in countries all around the world to make people leave and go homeless all the time, right? So we need to rethink the way we talk about and see what happened in Asian countries and understand that it is possible to stop the virus using the suppression model in all countries across the world. And we need to have one single campaign to support the entire planet, because this is a global mass emergency, and to be doing it haphazardly in each individual country, it doesn't make any sense. Like resources need to go from China to Europe to Americas, and then as it slows down in those countries, we need to get resources in other countries across the world and coordinate this globally, because if we don't, millions and millions of people that don't need to die will die. So let's think some more about the overall numbers here. Actually, we'll get into the overall numbers in a second. There's just a couple things that I want to mention before we get into this. I think that the foundational line that I've heard that really I'm just going to keep repeating is that the ability for our current government and overall societal systems to function in this day of age is a failure of imagination. People are not able to imagine, understand the severity of the situation, and the ability to actually implement a scientific model that stops the coronavirus instead of just mitigating it. And we need to go over some of the articles that can show us how that works. There's a really good Medium article. Let's look it up here. So Medium, coronavirus. You must act now. I think it's the second one, Hammer into the Dance. So this is a good article amongst many. Everything we talk about, you can basically just Google. But this has a couple of very important graphs. Let's see if we can find it. It might be in the previous article if we can't find it here. But basically this shows that you're going to be going over a lot of ICU beds with the mitigation model, and you're going to end up having a much, much worse death rate because of the increase. Oh, here it is. This is it right here. It's the first one, and I passed right over it. So if we do nothing, we're looking at about 200 million deaths across the world. Typically in a year, you have 50 to 100 million deaths, like 50 million deaths per year is the normal amount right now. So 200 million deaths will be about 4 times the normal amount of deaths. The mitigation model, which is what's happening in most countries besides the Asian countries, you're basically, reducing that to doubling the death rate for the year. So maybe you have 50 million deaths across the world, possibly more. So the mitigation model does help slow down the virus, specifically when you lock people down, you don't allow them to travel, and you have them in their houses. It does slow the virus down, but it doesn't actually stop the virus. So the suppression technique, which in this article they're calling the hammer, it actually stops the virus and exponentially brings it down, right? And then you have negligible deaths. So when you think about it, you are looking at, the death rate being in the tens of thousands as opposed to millions, right? So the normal, if you're looking at just the mitigation models, you're looking at millions of deaths, whereas if you're looking at the normal models with the suppression technique, you're looking at more of like hundreds of thousands of deaths. So we'll go over that in more detail, but the key is that understanding that the mitigation model still has significant exponential growth and exponential death rates, whereas doing a model that is a suppression model has a much smaller reduced death rate. And as you can see here, it is getting really problematic. The other key thing to mention before we get into details is that when you do the suppression model, it can exponentially bring down the death rates in the cases, and you can get your economy back and running in weeks instead of months and years, right? So as you can see here, China is already fully functional. They've ended all the lockdowns. Their economy is functioning and is back in order and operation, and they're trying to help the rest of the world with all of the materials that they're going to be manufacturing and sending everywhere, which is crucial for all of us, right? But when you look at what happened in China, for one day they got into the purple area, and how many days and weeks that you're getting into the purple with no end in sight for American countries that are using the mitigation model instead of the suppression model, there's no end. It just keeps going and going and going. It could last for months, because even as you slow down the virus, it's still exponentially growing, and even after it exponentially grows, instead of coming down exponentially, it goes down slowly. So you still end up with months and months of purple death. As soon as you start the suppression model, it will collapse the spread of the virus in weeks, and then you can restart your economy immediately, right? Immediately. So what is the best way to do that? Let's look at South Korea model quickly and make a few notes here with the South Korea model. So South Korea model. So basically it's testing and tracing and treating. That's the model. And when we need to do tons and tons of tests. And I'm just going to break this down quickly because we're going to go in more detail later. But number one is you end up with, testing everybody that you can, test everyone you can, and then trace everyone they came into contact with. So that would mean if we did this on a global scale, we would need to hire millions and millions of people to do the tracing, right? And then we need to do millions of testing. There's two types of tests that we found out. One is the RNA test, where you're actually directly testing the virus. And this test requires detailed chemicals and reagents and technology machines that are expensive. And then there's a blood antigen or antibody test, which is just a normal blood test, and is very, it's very simple to manufacture in mass quantities. So this one is more difficult because you have these reagents and chemicals that are bottlenecks, whereas the blood test can be done in massive quantities where you can make hundreds of millions of tests and even billions of tests and get them spread out across the world very, very quickly. This is basically real time, so it's like, do you have virus today? Whereas this test is, did you have the virus 14 days ago? So it takes about a week to 2 weeks for your body to create the antibodies to fight off the virus. So it's kind of in the past. So when you do the blood test, it's much cheaper, much simpler. It can be done in doctor's offices all over the world, and you can do it in mass quantity, but it only checks the virus load from the last 14 days ago as opposed to immediately during the day. So the overall recommendation on this one is that the RNA test should be kept for frontline workers, healthcare workers, making sure that they are getting tested regularly every week, if not every twice a week, and that everybody out in the field, right, is going to be healthy, and that the blood test is more for the general population. So that's the general direction we're going on the recommendations on that. Another way to think about it in terms of interacting with businesses and why it's so important to businesses, and we'll get into more detail, but just think about this. every time we talk to somebody who is an elderly person, they tell us the grocery stores are going to be open from 7 to 8 a.m. And they could go and all crowd in there in the morning for an hour before the grocery store opens, right, to get their food, and then nothing else changes, right? So that's option one. And then option two is when you go to the grocery store, they do the temperature checks at the front door. Everybody has to cover their mouth and their nose, right? All the employees are covering their mouth and their nose, right? They're wiping down and sanitizing all the stations after every single use, right? So that when you punch in your card number, or you're paying or whatever, always sanitized. They're sanitizing, the desk after every use, or at least wiping down with vodka, whatever you can get. And they are limiting the number of people based on the number of aisles, so that there's only one person in the store per aisle, so that you don't have to be within 6 feet of anybody, right? If you ask an elderly person if they'd rather go in the morning and crowd in there in the morning, or if they'd rather go to a grocery store that actually does suppression models to stop the virus in its tract, where everybody's being safe because they're wearing protection of some sort, every single elderly person I have talked to always would rather prefer going to a grocery store that is safe, right? And it makes a lot of sense because you're more likely to get the virus from a worker there who's interacting with the public constantly in the morning, right, than you are going to get it with the public anyways, either way. So it's just the most important thing is the suppression model, and we're going to go over it in detail. Everybody, every business, everybody needs to understand this so that we can put pressure on our elected officials. So a couple of states in the United States and in other countries that are corrupt, have been talking about protecting the economy being more important than protecting lives. And what we know is that the best way to protect the economy is the suppression model. By immediately suppressing the virus, getting rid of the virus, and making sure that the public doesn't have the virus when they're interacting publicly by testing people, right? That's the best way to get the economy back and going, because you get your economy back and running in weeks instead of months or years, right? So there's no better way to help your economy than the suppression model and getting people back to work and protecting our workers who are working. One governor so far in the United States has declared that all local ordinances that make stay-at-home orders or that protect people from the virus are illegal, right? And that is just a travesty of human proportions, and it really is a human rights abuse as far as the people are concerned, and it is against every single human rights treaty in the Declaration of Human Rights across the world. And people need to understand that we are in a global pandemic, and that there is no right for any leader or someone in power to institute policies or to not institute policies that end up with the death of any number of people, let alone millions of people, or in this case, tens of millions of people, right? So based on our current Declaration of Human Rights globally, there are protections for the people, and all people have the rights to protect their own communities and to save lives for themselves and each other. And we all need to come together across the world and protect each other in every single community across the world, regardless of whether or not there are laws or leaders in those communities that are trying to enact laws that will kill people, right? So it's unconstitutional. It's against the treaties on human rights to be either allowing your community to abide by laws that are going to kill people. And it's similar to when you have soldiers who follow laws in war, right? When they don't enact those laws themselves, but they basically follow them knowing that they will kill people, that is a war crime, right? To follow laws, if you are an employee and you're working somewhere in government or whatever, and you're following laws, or you're following what leaders are saying to do, and you know that those laws or those rules or those executive orders are going to kill people, it is against human rights and a war crime to follow those laws. Even if your boss tells you to do it, you have to go against your boss. You have to go against the leaders of your countries to save lives. That is how the Declaration of Human Rights is set up, and everybody who is pushing laws or rules that will end up with additional deaths should be held accountable. And I just want to encourage everybody to take their lives into their own hands, to take the lives of their families into their own hands, to take the lives of their communities in their own hands, and then work together with the government. And we're going to talk about how we can put pressure on the government to ensure that we are saving millions of lives, if not tens of millions of lives. So I want everyone to protect your family. That it's not enough to think that government officials across the world have this under control, because they do not. If they did have this under control, we would not be seeing the massive exponential growth in death rates happening everywhere. From there, when they tell you that, oh, washing your hands is enough, and that's all you have to do, and just don't cough and sneeze on people, it's false information. If that was correct information, there wouldn't be exponential growth all over Europe, all over the Americas. It is not working, right? We know now that the virus spreads much more quickly and much more easily than simply just washing your hands, right? You have to cover your mouth and your nose. Anyone who's not covering their mouth and their nose, right, needs to be told that is not okay, right? And that needs to be culturally frowned upon for people to not be in public with their mouth and their nose covered. If you're running your business, you need your employees to be covering their mouth and their nose, because it will save lives, and it will save the lives of your employees, and it'll keep your business running. When the public comes into your business and they see all the employees breathing and coughing all over the food, breathing and coughing all over the products, right, and not covering their mouth and their nose, people don't want to buy there, right? People know it's contaminated. They don't want to go out in public because they know that they can get the virus very easily. If your business is smart, your business will make sure your employees are covering your mouth and your nose with whatever you can find, and making sure that you're not breathing and talking and coughing and sneezing all over the products that are being sold to the public and spreading the virus, right? Also, it will keep your employees safe from the public so that they're not spreading the virus. It is more likely that once one employee, let's say you have 20 employees in your business, right? You're going to get one employee sick, and then that employee is going to spread it to all the other employees before another person in the public is going to get your employee sick. So once one employee gets sick, right, you have a probability of any one of your employees, of your 20 employees, get sick from any one customer, which is much higher. Probably you have 20 times more likely that one of your employees is going to get sick. Once one of them gets sick, it easily spreads between all the employees, and that's the problem. That's why you need to protect your employees, not just from the public, but from each other, and cover your nose and your mouth, right? So that's just a duh sort of thing. To make you understand the importance of this, everybody right now is talking about how this is a medical emergency and a medical crisis. But it's more than that. It is much, much more than that. And I'll try to explain. Right now, you have Amazon workers all across countries across the entire world spreading like wildfire. The virus just spreading between Amazon workers. They're not covering their mouth, they're not covering their nose when they're working in the warehouses, and they're spreading the virus like wildfire to all the Amazon workers. Once the supply chain collapses because all the workers are getting the virus, this is no longer a medical emergency where the hospitals are filling up and getting overrun, right? That the medical emergency is already a disaster. We're talking about potentially tens of millions of people. We're going to go over the death rate soon, but we're looking at tens of millions of people potentially dying if nothing is done and we don't do the suppression model globally immediately. So, but even worse than that, if the supply chains collapse because we don't protect our workers and our businesses are pushing people to work and not protecting them by covering their mouth and their nose and doing temperature checks, we're going to go through all of the details to protect your business, to make it not fall apart and make sure that the supply chains, and when you are getting supplies from somewhere else, your business needs to ensure that the business that you're getting the supplies from is also following those protocols, because those protocols are going to save lives and they're going to keep the supply chain open to make sure that everybody is getting the basic food and medicine deliveries, so that when people get sick, that they're that they're not getting sick in the first place, right? Furthermore, we need to just be smart about it, right? Let's just breathe We need to follow the science. We need to understand that this is a new situation. Applying old rules of the flu to this new situation of coronavirus is not going to work. We need to use the science. We need to work with countries that have got it under control. And we need to understand that the best thing we do for our economies is to get our situation under control immediately. And we know exactly how to do that. And that's what we're going to continue to cover in detail in this video. So again, I just can't stress the importance of protecting frontline workers. Frontline workers are the foundation to the supply chain. If our supply chain fails, the medical emergency will look like chump change. Instead of tens of millions of people potentially dying, we're looking at hundreds and hundreds of millions of people dying, if not a billion or more, because the supply chains and the food chains collapse, right? People don't want to go to work if they don't feel safe at work. People aren't going to be going to work if everyone at their work is getting sick and dying, right? So if you are a frontline worker and a supply chain worker, you must demand that all the employees and that your business follow the suppression protocols regardless of whether the government says to do it or not, because it saves lives and it is essential to protect yourself and your family and to protect the supply chain for the entire society so that people continue to get food and water and electricity and medical supplies. Okay, so we're going to go all of this in detail. And again, why does everybody need to wear to basically cover their mouth and their nose? I don't care what you cover it with, whether it's a mask, whether it's a tissue with rubber band, whether it's a cloth or a shirt or whatever. It needs to be done. And the reason is because half the people with the virus don't even know they have it. It's as simple as that. Therefore, you must wear something over your mouth and your nose. It's just that simple. It's science. It's just science, right? It's not a cultural thing. It's not like, oh, only people in Asian countries wear things over their mouth and their nose. No. It's that when you go out in public, right, it's basically like with AIDS where you're not wearing a condom, right? You must wear and cover your mouth and your nose. It's the same thing. And if you're not doing that, you're allowing the virus to spread and you're only mitigating instead of stopping it. Right? The difference between mitigation is that the mitigation allows the virus to continue to spread. It only slows down the spread versus stopping it, which stops the spread of the virus, where there's no longer spread of the virus. And then when you stop the spread of the virus, you can get your economy back to work and get people jobs and make sure that the supply chain doesn't fall apart. All right, so we are talking about simple, basic science that's proven that the other countries have done this and succeeded, and we can too. The most draconian thing possible to do is locking down your country and making people stay at home. There is nothing more draconian. If you follow this, the South Korea model, you don't have to do that, right? You can do mass testing. You can do mass tracing. We need to hire millions and millions of people. People need money for work and everything. We have jobs for them. We need to hire them to do mass tracing across the entire world, right? That is essential and can be done without locking down or even stopping your economy at all, as long as people are covering their mouth and their nose so that they're not spreading the virus everywhere, right? So that's how you do it without draconian measures. As soon as you don't do that, then you get into draconian measures, which is closing down the country and locking everybody in their houses and telling them not to leave, right? It's not a quarantine until people aren't allowed to leave. Right now, people in many countries are allowed to go and get food and interact publicly. So it's not a quarantine, but it's pretty close, where it's basically a stay-at-home orders, and they are only going to be mitigation unless you change our cultural models and use the science to our advantage to stop the virus instead of just mitigating it. And we will talk more about it. But let's go ahead and get into the death estimates. So overall, under our estimates, and we'll go over it in detail, our estimates are about 2 million people dying across the world if we do the suppression model as soon as possible, right? So let's look at the data here. Oh, and by the way, I always forget this, but just to finish up on our introduction, stopcoronavirusglobal.com, stopcoronavirusglobal.org, those are going to be our websites. We're still in construction, getting them set up. Info at stopcoronavirusglobal.org or you can email us and get in touch with us. We also have our Facebook group, Stop Coronavirus Global, et cetera, and we are looking for people to get involved. Our meetings are during full moons, new moons, quarter moons, and other planetary cycles. So we have sessions every week, if not multiple times a week, and everybody is welcome to join us and to help out. All right, so let's go into projected cases and deaths. So this is very easy to get this information. We find that the best place to just get all the cumulative death rates is just on Wikipedia. You can they have all the sources listed here with every single detail of where they get all the information, and it all adds up. We're at 500,000 cases now across the world, right? The United States is easily going to surpass Italy and China in days, right? There's just no question about it. So the United States will be the epicenter of this pandemic, and obviously it's just spreading across the entire world, and we'll just see it go to other countries across the world. So let's get to the death rates here. As you can see, everything's growing exponentially. The most applicable graph for just understanding total deaths is this one, right? This one really gets what you need. You can see there's a slight decline going on in the exponential growth of the death rate, but there's not really a decline in the number of cases. So why that is, it's not really clear, but that's kind of what we're seeing. So if we project that out into the future, and we just sort of see, month by month, so you have February, March, April, we're coming up to April, and you just project out the current trajectory of cases and then the current trajectory of deaths, and what you see is startling, right? So the first one is if you immediately stop within a week and you do suppression across the entire world, right? Everything we're talking about is globally. If we suppress the virus globally, it will protect yourself and your family and your community and your country, right? So if we work on this together, it'll be much more effective and save many, many more lives. So basically what you have here is if you stop immediately right here, within a week, you get a death rate that comes out, and maybe it slows down a little bit but continues rising. It's about 700,000 deaths. That's about equal to the flu for a normal year. So if we are able to suppress the virus and just immediately lock everything down and suppress it more than just lock it down, we'll go over the details of suppressing it. You're looking at 700,000 to a million deaths. Right? Overall, in a year, you have 50 million deaths, so it would be equal or normal death rates overall for the world, and you'd be looking at kind of like a similar to the flu, right? The thing is that's not particularly reality right now because, who's going to listen to me, right? I make $1,000 a month. I'm putting as much as I can into getting this information out there, but no one's supporting. We don't have any donors. We don't have any, funds. We don't have, we don't have any additional donors or investors or funders who are supporting this cause, right? And so if you're interested in getting involved and helping, it would be great to get the word out. But there is nobody, like the UN is doing little to nothing on the suppression model. The whole global system is functioning on mitigation. So if you look at mitigation model, it continues to exponentially go up. We do have this clamp down, and I think it's half of the world is basically on a stay-at-home order at this moment, which means that we are expecting to see a slight decline in the exponential rate, and there is positive data coming out of locations that basically had stay-at-home orders and shut down, but it's like you see there in China, they did the suppression model and it stopped and it exponentially came down. Whereas when you do mitigation, you're getting this slow reduction, but it's not actually going down quickly, and so you're still getting this growth of the virus. So if we basically keep as we are now, right, we're expecting it to come down a little bit, right, but we are looking at 50 million deaths, which would double the number of deaths for the year, right? If nothing happens at all, which we already are past that point, we would be looking at as much as 1 billion deaths or more. But hopefully that's not going to be the case. But it's certainly possible, right? If nothing happens, I think we're looking at 200 million deaths, which would be 4 times based on what we're doing. And that, but if we do very little and we just mitigate, and then it comes back next year, it could be 50 million deaths this year and another 100 million deaths next year. There's no guarantee that it just stops with the mitigation model. You have to do the suppression model to stop the virus, right? So basically, what we're looking at is if we are successful, let's say we give ourselves another month to suppress the virus, right before the beginning of June, right? So it'll be coming in right around here. So it goes up until right around the end of April, and then you pull it back. We're looking at as many as 50 million deaths. Okay, so what we're saying is with the mitigation and maybe suppression kicking in quicker, maybe the average here, if you get it kind of mid-April, we'd be looking at 2 million deaths, right? So the question is, can the world come together to unite and use science and proven effective measures to, one, stop the virus in its tracks using the suppression method instead of mitigation, and two, get the economy going, getting people back to work as quickly as possible, right? Again, just to remind you, what the mitigation model looks like, which is what Europe and North Americas are doing, right, is it looks like weeks and months of war zone, right, of hospitals getting overrun, of people not being able to be put on ICU units and get ventilators and getting help medically because the hospitals are overrun. You can't even get the help, so people die. In the increase of, like, if you look at these numbers in Italy, it's insane, right? Let's look at the Italian numbers again. Right, so for Italy, you've got 74,000. Wait, this is a little old. Let's refresh. Oh, look, the United States is already #1. I told you guys US and United States was going to be surpassing Italy and China. I didn't realize it was going to happen that quickly. Okay, so basically Italy, you have 80,000 people getting the virus, equal to China and the United States, and they have 8,000 deaths. So what you're looking at is 10% death rate in Italy. The reason why it's so high is because the people are not being able to get medical care because the whole entire medical system is overrun. And I don't know what's going on with their supply chain per se, but I think the supply chain is still functioning. But if the supply chain collapses, trust me, it's all over. Like, you're going to see the death rate go up to 25% or more. All right, so we need to protect those workers who are on the front lines, including all the food workers, all of the medical workers, all the pharmacy workers, everybody in the supply chain, as well as the medical workers. All right, so anyways, these are dire, dire numbers, and it just proves that what the United States is doing and what Europe is doing does not work. Do not only do the mitigation model in your country and in your community. It doesn't work. We're looking at the United States easily having 300,000, even 500,000 cases at this point, and it'll be hard to not get to those numbers unless they immediately turn and change to a suppression model, which would then basically stop the virus and end this whole war in a week. We could, or 2 weeks, right? It would take that long, and then you can get your economy back and running in a month, right? All right, so let's finish up with our projections. Again, we're looking at somewhere between 700,000 and 50 million deaths. And I know it sounds like a huge leap, but because everything's logarithmic and growing exponentially, a few extra days and weeks just, exponentially increases the number of people who die. So the halfway point between 700,000 and 50 million is about 2 to 5 million is the halfway point, right? Because it so quickly exponentially rises, so that going from 2 million to 50 million is basically the halfway point, okay? So right now our goal is trying to stop the coronavirus globally and keep the deaths to 2 million people, because we don't see any other way to prevent more than that based on the data and the trajectories of what's already happening. It's not possible to just stop. I mean, these trajectories are based on social patterns of science, and you can't just like click a finger and be like, oh, people no longer are going to be sharing the virus. It's like, no, scientifically, when people get together, the virus spreads. And if people have to go to the grocery stores, and people have to go to the pharmacies, and people have to work because they die if they don't work, because they don't have food. Many countries, people will not get food unless they work, right? So the virus will continue to spread unless we do a global campaign to stop coronavirus globally and immediately. So hopefully these numbers understand. We'll constantly be reviewing these numbers and reviewing the projections as they evolve from, usually it's about a week to get the new trajectories, but we're expecting to see it go down, and hopefully we can project better numbers, but we need to be realistically preparing ourselves for worse numbers. All right. Now we're going to go into what we do about it. How do we actually solve and fix the problems of the government response basically being a mitigation response instead of a response based on scientific suppression of the virus that has already been proven in multiple countries. And nobody globally is implementing it at a global level. And so we are trying to do that. We want to work with other organizations. So if you're an organization who's actively doing the suppression model across the world, we want to work with you. So basically, the next thing is the action steps. What can you do to help this? Obviously, number one would be to share the information, right? Let's get this information out. Let's share it and tell people about it. One, share the post. Get people watching this video. It's a long video, but it has detailed scientific information to make sure that you can protect your family and your loved ones and yourself, and make sure that you can protect your community, right? Otherwise, millions of people are going to die. There's really just no way to say it less bluntly, like, let's get this video out there. Let's make better videos than this one and continue to make it clearer and clearer to the public and educate the public that we have to change everything about what's going on right now, and it needs to be done globally, because as you see in China, all of the cases in China are coming from around the world, people coming back into China and spreading the virus more in China, right? So they're able to easily stop it at their borders because they know how to suppress the virus. It's really not that hard. And we're going to go over in detail how you suppress it very, very soon. So step 2, educate yourself. Education. Watching this video is part of the education, right? But don't believe everything that I say just because I say it. Yes, I've read thousands of articles or hundreds of articles and pulled all this information together to try to share with you, but you can still get more information. One of the articles that's really, really good is the New York Times article on Monday. So it was like 3 days ago. The New York Times article, "The virus can be stopped, but only with harsh steps," experts say. So it goes over the global expertise and the global consensus of exactly how the virus is stopped and why it can be stopped. And so everyone needs to understand that. That's a great place to start. Also, I already showed you the Medium articles over here, where you have a bunch of groups or a bunch of people working together with Thomas, and really getting the data together to show what a disaster the mitigation model is and why it is shown, overrunning the entire hospital systems anywhere and everywhere where they do mitigation. And then where they do the suppression model, boom, you stop the virus, and then there's no virus, and the economy gets back functioning, right? So if your leaders are allowing the mitigation model to move forward, not only are they killing people because the science shows we don't have to do that, they are also destroying their own economy because their economy can't function, right? Again, it's a failure of imagination. The leadership, especially in the Western world, is just completely balking at the ability to handle this crisis in a way that is functional. And so at that point, the people need to bypass the governments and force them to do what is the right thing and to follow the science and to save lives. It's really that simple. And that's what this video is about. It's about taking direct action. So after you educate yourself, then what do? You call your representative or you call your government and you tell them to follow a plan that actually is going to stop the coronavirus in its tracks. That they cannot do mitigation, and they cannot just do social distancing, and they cannot just do lockdowns and stay-at-home orders, right? That it's not enough, right? Italy started locking down February 22nd for northern Italy, right? A month later, on March 23rd, they still had exponential growth of the virus, and they still had a complete collapse of their medical system. It didn't work, right? So the lesson is simple. It's not okay to start basic functions of the suppression model a month after you lock down. You have to do it all at the same time. You have to do it immediately. Like on March 23rd, I think, or 22nd, Italy finally did the procedures that were required. Italy stopped allowing trains across their country and people to cross throughout all the counties and travel all over Italy. Right? It took them a month after the lockdown, after the stay-at-home orders, to stop the travel. Italy, right, made so that temperature checks were required to go into grocery stores and pharmacies, right? A month after they locked down the country, right? Italy basically got more strict after the government experts from China came to Italy and told them they were a laxed joke. It was laxed. It was a joke. This was not stopping the virus. It was only mitigating it. And then Italy quickly got into gear, right? You see similar things happening in other parts of Europe, but mostly they learned from Italy's lesson and got much more cracked down on keeping people in their houses and not allowing people outside, which again is the most draconian you can get. And there's much easier and simpler ways to stop the virus scientifically without having to, do these horrible draconian measures. But whatever, if your government doesn't actually take care of the situation, then your only option is draconian lockdowns and uh, you know stay-at-home orders. I mean, you have no other option. So that's why we're all basically locked down across the world right now, is because our governments did not uh, act in time. Right? It's pretty much what it comes down to. So when you call your government, you might not know exactly what to say. So we've created a cheat sheet. And it's pretty simple. Hi, my name is, what is your name? You live at, let them know where you live. And you're telling them that you're extremely worried about coronavirus and you're worried that the government is not taking enough action to suppress the coronavirus and stopping the spread. Even with all of that's already been done, including the lockdowns and the stay-at-home orders and all of that, right? Even with all of that, it's still not enough, right? And we know from the scientists and the successful models in South Korea, China, and other Asian nations, right, then you follow the suppression model, that it stops the virus, and that mitigation allows the virus to continue to spread indefinitely, right? So with mitigation, it never actually goes away. It just keeps going, 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 and you keep getting more and more of the population, even a slower trajectory, you get more and more of the population sick, and then you end up with the virus mutating, and then it comes back with a vengeance again in fall or next year, and it just never ends, right? And then eventually you'll get to the point where you are able to get herd immunity and vaccines, right? But that takes a year or more. And the problem is, like, let's say you did nothing. The problem is that 1 billion people die within 3 months, right? So we're talking, it's almost April, May, June. So this is June. Made a mistake there. June, April, May, June, right? Boom. If nothing happens and we continue on the trajectory we're on now, we're talking about 1 billion people by like June, July, right? Who are dying, which is crazy. I think that number is a little lower because of the doubling. So maybe it's only like 200 to 500 million people, but we don't have like a year or two to wait to mitigate. It's just not enough, right? I don't think that it's going to be that bad. I think that with the mitigation measures, and if we actually stop the virus, we can hold it much, much lower, the number of deaths. But why even mess around? Why not just follow the science, follow the leadership of the countries who already showed us how to solve this problem, and give them credit for it where they deserve it, right? There's just no reason to pretend like, oh, the Western world, we're so smart. we're able to fix everything ourselves and we're going to create everything new out of scratch because we know how to do it better, when the Asian world and already solved the problem, right? They're the ones saving lives. They're the ones who have the model. We just need to follow it to save lives. It is not a problem. We can save tens of millions of lives across the world. Okay. All right. And for those who think like, oh, maybe it's good for less people to die. It'll be better for the environment. Da, 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 da. The answer is no, right? The answer is by saving lives, by building a coalition across the world to actually solve this problem and to help and have wellness and healing across the world, right, is the same thing as healing and wellness for the planet, healing and wellness for the environment, right? Our global campaign to stop this virus is the same campaign that will also heal the planet. There is no difference. So the idea that somehow allowing chaos and destruction across the world and having everyone die is somehow going to magically make the planet, healthier is just not the case. In the short run, for like a month or two while everything's locked down, the planet's going to get a great fresh breath of air, right? But that's going to end real quick when regulations get destroyed and everyone just focuses on themselves, and then you're going to get even a potentially worse effect on the environment afterwards. Anyways, we don't need to get into the details on that. Let's focus on calling your representative. So the point is that you need to tell your representatives that they you ask them if they understand the suppression model. If they don't understand the suppression model, we have some details here on, this is the detailed cheat sheet. So there's two models, one if they understand, if they don't understand. There's only three crucial components to the suppression model that are needed to be enacted if your population is on lockdown or some type of stay-at-home order, right? So if you're on a stay-at-home order, there's only three things. So the first one is that you need to stop all internal and external non-essential travel. This is so important because if you don't do that, the virus continues to spread, and it continues to spread across your country and globally. Right? There's no way to stop the spread of the virus if you allow travel to just continue unabated. So in the entirety of the United States, anyone can travel anywhere. Even in California, we're on lockdown. We've been on lockdown for over a week, and we can travel. I could get in my car and travel down to LA. There are no roadblocks. There are no, preventions of traveling. All the public transportation is open. It doesn't make any sense in terms of suppression of the virus. It's a mitigation model. So if your country is allowing travel to happen, they're just mitigating the spread of the virus instead of stopping it, right? They're not suppressing and stopping the virus. They're mitigating it and allowing people to continue to spread the virus. If you are working in public transportation or you're working in any field where your travel is necessary for frontline workers, that's fine. We can allow essential travel to continue. You just need to cover your nose and your mouth when you go out in public and anywhere you travel. And you need to make sure that you are getting tested, right? And we'll talk more about the testing. It's number three. So number two, at all grocery stores, at all pharmacies, at any and all locations where public people go indoors, right? If you go indoors, right, period, you must be wearing something over your nose and mouth. It is required. You have to do that. Every single entrance to every single store, there should be temperature checks, right? You do infrared temperature check on the forehead to see if someone has a temperature. It's just needed and required. So you have someone at the front door. We need to hire millions of people for every single store, every single grocery store. We need to hire people to work at the front doors to do temperature checks and to make sure they're covering their nose and their mouth. That's a good thing. We need more people working. We need more people employed, right? So the idea that this not a good thing is too much work, it's just nonsense, right? So every single grocery store, every single location that has people going indoors, you need to cover your nose and your mouth with anything you can, and you need to make sure that you're doing that. Additionally, stores should be doing much more than just that. All of the employees need to cover their nose and their mouth, and you need to be sanitizing or cleaning using vodka, water, whatever you can to clean with. All the different services, every single person who uses a touch card reader or whatever, it needs to be cleaned off after every person. you need to clean off the table after every person. You just need to be being smart. Follow the scientific models. Don't just pretend like being a foot or two away from someone is perfectly fine and that you don't need to cover your mouth or your nose. It's just nonsense. There's no like scientific or logical rationale that says that this virus functions like the flu and that you basically not going to get it by talking with people who have it within a foot away from you. It's just not realistic. You need to, if you run your business, you own or you're a manager, you need to protect the workers by having them cover their nose and their mouth, and then all the workers need to get tested. So that's number 3. So the third part is testing, 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 testing. Right? All frontline workers, all medical workers should all be getting tested weekly, if not every. For medical workers, especially when you're working with people who are sick, maybe twice a week. And ideally, they would have RNA testing and direct viral testing, whether they have active virus in their bodies. From there, we can easily do mass testing to everybody using the blood testing models, where you can be ordering and setting up shipments of millions, if not tens of millions of tests within weeks. It's just so much easier to do the antibody test in mass volume, which is a blood test. So doing that every week or every 2 weeks is enough to make sure that all workers who are going out in public do not have the virus. It's really that simple. And testing is the foundation to jumpstarting your economy, right? You test all the workers, they go out in public. If everybody who leaves the house is tested and they don't have the virus, then it's not possible to spread the virus, and scientifically the virus is suppressed and then is stopped, right? So I don't know how else to explain it to you guys except for that it's simple. Basically, it's simple, and the scientific community across the entire world agrees on it, that it is possible to stop the virus, and you just need to do simple things. And the most draconian thing impossible to do is locking everyone in their house and telling people not to leave, right? The stay-at-home orders, right? That's the most draconian thing that you can do. And if you've already done that, you might as well do all the other little things to actually stop the virus. Why continue to allow it to spread when the little things are what stops it and are more important than the actual, putting everyone in the house? The only reason you have to put everybody in their house and not leave and close down your economy is because you're not suppressing the virus. If you were suppressing the virus to begin with, none of that would have been needed to be done in the first place. So once you get everything back up and running, you can easily suppress the virus without having to close your economy down over and over and over again. Anyone who talks about these endless waves and waves and waves of closing down the economy again and bringing it back up, it's all mitigation, and it's all not following the science of the suppression model, right? We know that China has already stopped the virus. You know that Hong Kong and South Korea have stopped the virus, right? To not follow that lead is just a travesty of tens of millions of people dying, and completely unnecessary, destroying the economies of the West in allowing the economies of the East to take over the world, which at this point looks like the direction we're going. So if people want to continue this mitigation nonsense in the Western countries, it's helped slow down the virus, it's good, but it doesn't actually solve the problems. And even for people who want to get everyone to work, even with 2-3% of the population dying, that's not going to help, right? Nobody wants to go to work. Your economy is not going to be functioning well when you have your hospitals overrun and the supply chain falling apart because everyone's sick and scared to go to work. It's not going to work, right? That is going to be a disaster. So instead, you can get everyone to work in 2 weeks simply by using the suppression model. So we created a quick little cheat sheet. It's got all the articles listed here, and this is what you need to call all of your government representatives and demand that they immediately do the suppression model and do those little things like make sure that everyone's wearing something over their nose and mouth, and that you're stopping internal travel, so that you're not distributing everywhere. And again, in our model, you can immediately start travel when you have testing, right? Anyone who wants to travel, perfectly fine. You can travel globally. You just get tested when you get on the plane, and you get tested and you do a self-quarantine for 14 days when you get wherever you're going to get, right? So as soon as you start testing everybody who wants to travel, travel's reopened. You can reopen the hotels. You can reopen all the global community models of the planet, right? So it's really not um, an issue of the economy. It's an issue just following the science. Once you follow the science, you do the suppression model, the economy reopens. China's economy is reopened now, right? It's done. We know how to do it. Okay. All right. So let me get a quick sip of water. So the next part here we're going to go into is the scientific criteria and what we need to be evaluating plans on. So we've created a plan. We're going to go through that plan. But every single country, every single county, every single organization, every single business, every single country, every single location and region and metropolitan area has a plan, and they're enacting a plan to try to save lives. All of those plans can be evaluated, right? If you have an evaluation criteria matrix to follow. So we're not saying our plan is the best plan. We're trying to just follow what South Korea and China and other Asian countries did and just kind of put it into a simple to read plan that anyone can follow from either their local community or on a national model. But we don't feel that our plan is necessarily the best or the right one or whatever. We just feel at least it's something, right? So if we have a scientific criteria, we can evaluate our plan based on that criteria and compare it to other plans for what their criteria is and actually have a set standard of fair application to each and every community that is implementing models and how good those models are going to be to actually suppressing and stopping the coronavirus as opposed to just mitigating it and allowing it to spread. So we're not saying this scientific criteria is perfect by any means. We're just saying that at least we're trying to create a scientific criteria that makes sense in some sort of logical and scientific way. Okay? So we're going to go through, I think there's 10 or 11, 9 or 10 different parts to the scientific criteria. The first is basically the thing that we went over. This is new information, but the science is clearly saying that 25 to 50% of all of those infected have no symptoms, right? That's just the science, right? So if you have a plan that doesn't scientifically apply the factual evidence that there are 25 to 50% of those people who are infected that show no symptoms, that means they have no idea that they have the virus and can spread it to their families, to the community, at grocery stores, at pharmacies, in parks, at beaches, everywhere in public because they don't know they have it. So if your plan is a mitigation model and allows people to just openly walk through communities, to openly walk through grocery stores without covering their nose and their mouth, it's kind of insane. It doesn't make sense. So that's part of our scientific criteria. Second one is that the plan needs to define the front lines and where the virus is actually spreading. So if you don't actually define where the virus is spreading, for example, grocery stores being a frontline place where the virus spreads, then your plan isn't going to be mitigating properly to ensure that it stops the spread of the virus, right? 3. We need to support and protect frontline workers and triage workers. We'll go over the definitions of the frontline workers and triage workers when we get into the plan that we have, but if your plan doesn't support workers at businesses and grocery stores and pharmacies, and that basically it's, go at it alone, good luck businesses, and not supporting the supply chains and the Amazon workers and all that, it's not going to be functional. No good. 4, you need to divert the masses away from existing medical system. If your plan, basically, if you're sick, your only option is going to a hospital, right? Or a hospital extension or some sort of nursing home, it's not enough, right? We need to divert masses of people, potentially tens of thousands, if not millions of people across the world, away from the medical system into a separate system infrastructure set up for the coronavirus. 5, the plan must be must lock down public interaction until travel testing checkpoints can be established everywhere. So that basically travel is fine, but only after we're testing. It's pretty unbelievable to think that you would just want people with the virus traveling everywhere. It doesn't make any logical or scientific sense. So travel's fine after you have testing. If you don't have testing and there's a huge problem, you don't know what's going on, you need to shut down the travel, shut down the roads, and shut down people basically leaving their houses, unless it's for emergency or essential needs. Number 6, the plan needs to be an economic plan that provides bonuses and incentive to frontline workers so that they can expand services and infrastructure immediately, including delivery services for food, water, and essential needs for all people across the entire world. Okay? So that's very important, right? And that's just the basics of our economic models for functioning during the pandemic. And we'll get into more economic for the restarting of the economy. Number 7, the plan must allow communities to take their lives into their own hands, even with ineffective or corrupt government. This is extremely important. On a scientific level, the science doesn't make sense if your plan says that any government official, leader, or president of a corrupt country can basically just wave their hand and be like, no, millions of people die. Right? That's not science. That's not going to scientifically save anyone's lives. Your plan needs to be evaluated on the ability for communities to enact it, to pressure the government, and to actually implement it without or in conjunction with limited government support, right? Because if we just wait for governments to do it all and they don't do it, the plan doesn't work. So with our plans, all of our plans are basically people power. This message is for everybody to just take their lives into their own hands. That's why we're creating this video. Number 8, the plan needs an economic restart component that allows the economy to get going very quickly, utilizing testing and other options to enable national economies to compete in the global arena, knowing that Asian economies are already getting back up and going and has successfully stopped the virus. So basically, if the plan doesn't quickly restart the economy and get people back to work and people feeling safe at work, then it's not a good plan. Number 9, the plan cannot allow for consistent waves of the virus emergence over and over and over again based on a mitigation and non-containment model. The virus breaks out of containment again, it must be stopped and not allowed to grow exponentially, period. No more exponential growth, period. You stop the exponential growth, you exponential decline, and then it never comes back. That's the suppression model and the stopping coronavirus global model that we are proposing and has been proven in South Korea, in China, in Singapore, in Hong Kong, and other countries. They've done an extremely good job at setting up this infrastructure to stop the virus. And it is an infrastructure, right? If we do this across the globe, this will be the largest, quickest infrastructure project ever done on the face of this planet to save millions of lives. It is very possible, it's very doable. We have the scientific proof, we have the means, we have the technologies, we have everything except for the will and the belief of the people of the world that it's possible, and to demand that our governments just do it, or to create new decision-making models to just make it happen, regardless of whether the old models of government are ready to change and transform to make this happen themselves. All right? And we'll get more into that in some of the limitations of our current government towards the end. Okay, so from there, we are asking people across the world to help out in the evaluation system. We want to evaluate each country with their ability and their model for whether it meets, the percentage of how effective it is in relationship to the scientific criteria. So again, we're not saying the scientific criteria is perfect. We're just trying to start with the general concept of what is minimally needed based on the science that you see functioned and worked in China, in South Korea, and other countries, to ensure that any plan, regardless of who's doing it, is actually a functional plan and evaluated to a level that makes sense. So we'll get more into that a little bit later. So we're going to go over the plan first, and then we're going to go over how to evaluate the plan in relationship to governments and businesses. And then that's the rest of this video. We'll conclude and end after that. So, so now it's time to get into the plan. we looked at the scientific criteria. That's basically what we based our plan off of. How do you meet all of those marks to ensure that you're meeting or exceeding what was done in either China or South Korea or Hong Kong or other countries that have successfully prevented the virus from going up exponentially, or to take exponential growth and to collapse it to exponential decline, right? So again, it's very important to understand when you're looking at these graphs that the mitigation model allows for exponential growth, right? And then it slowly stops the exponential growth, and then it comes down very slowly, right? That's the mitigation model, right? The suppression model, sometimes there may be exponential growth, and then it collapses very quickly. You have exponential decline, and then you basically, need to finalize your stopping after the suppression. And some places only have no exponential growth at all. I think there's some graphs of that. Let's see if we can find any. Yeah, some of these countries here where you basically just don't have exponential growth, and that they stay lower, including a lot of the Asian countries that have more experience with this. All right, so let's get into the plan. plan, 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 plan. All right. I think we just have to click on the link up. Yep. Oh no, it's our organizing plan. We're looking for the plan to stop the virus in its tracks. Here it is. Stop coronavirus. No, that's the organizing plan. I think I linked it on our notes. Notes plan. Here it is. Plan to stop coronavirus. Oh no, that's the organizing plan. Sorry here, guys. So in our government cheat sheet, we should have the link to the plan, right? No. Messaging doc. There we go. So finishing up with the message doc, so you need to call your representative. You can join all the groups if you want to get involved. We're looking at trying to build, millions of people across the world helping with tracing and tracking and, building this infrastructure. So the more people who want to get involved, the better. It's not necessarily us and our organization. We want to work with other groups who are doing this as well, including governments. Read more about our scientific criteria. So we went over the scientific criteria. Now we're going to go over the plan. So let's link on the plan. All right, so this is the plan to stop exponential coronavirus growth in its tracks. Again, our goal in terms of saving lives is different than a lot of other organizations. A lot of other organizations are working on very different components of the coronavirus pandemic and crisis. For example, a lot of groups are working on expanding and supporting the medical professionals and the hospitals, which is great. We love that. We want the hospitals to be expanded. But if there's exponential growth, it doesn't matter how many hospital beds you make, right? Another couple days later, the hospital beds that you've created will be overrun again all over because of exponential growth. So the only way to save and help the hospitals and help the entire society and the economy and everything is to actually stop the exponential growth of the virus. That is really the number one thing. And then from there, stopping the virus itself and using the suppression model, etc., etc. All right, so one thing I'll just notice here is that we do support the Declaration of Human Rights as the foundation to everything that we are proposing, because it is, we have a right as people in the world to save our own lives and save the lives of our communities and to take action. So that's really what it's all about. So what's the vocabulary? The vocabulary is pretty simple. The front lines is 100% of the population. Everybody's on the front lines at some point in relationship to buying or selling food, going to the grocery store, having a delivery at your front door, right? Basically your front door, and anytime you leave the house or interact with anyone who comes to the house or goes to a grocery store or any other store or the hospital, that is an interaction with the front lines. So there are 7 components to the front lines. One is, retail distribution, just basically all the infrastructure for supply chain, including medicines, packages, mail, government services, garbage. And then you also have the police and the fire and other components of just like everyday interactions in life. 2 is the delivery and pickup so that you can stay home and still get supplies. This is especially important in some third world countries where people are dependent on food daily. They're going to need immediate access to food in order to even be able to stay home at all, because they don't have money because they work day to day, and that just needs to be set up immediately. Fever clinics and pandemic clinics set up specifically to not have people with symptoms going to existing medical system. We'll get more into the fever clinics, but basically you need to be going somewhere with your symptoms. That is not the normal medical facilities. Otherwise, you're just going to spread the virus at the hospital and it's not going to help. The fever checkpoints is everywhere in a local community. You need to require people to check their temperature, to go into stores, and to interact in certain public areas. Travel testing checkpoints. Basically, if you want to get on a plane, that's fine. You get it tested. I mean, it's really that simple. You want to fly to another country, you get tested. You're probably going to end up in some type of 14-day quarantine, right? But as long as people are doing their testing and self-quarantining when they're traveling, there's very little risk of spreading the virus. Like it's and it certainly will keep the virus from spreading exponentially. So it's simple. It allows the economy to restart basically immediately. As soon as you start testing people, you can restart the economy. People can start traveling because they're tested, right? So it's simple, it's straightforward, it's scientifically proven. It's also exactly how China, South Korea, and other Asian countries are preventing the growth of the virus in their country now, because all of their cases are coming externally, right? And they're coming into the country, and then they stop them at their airports and at the borders, because it's really simple to screen people, test them with their temperature, and they test them to see if they have the virus, and then they quarantine them for 14 days. It's not that complicated, right? Anyone can do this, right? And in this self-quarantine is fine. Put them up in the hotel. Put them up, wherever they need to be. It's not complicated, right? You don't need to do draconian, like, especially in democratic countries, there's no need to set up some sort of draconian thing where like people are basically locked up because they may have the virus. It's not necessary. People will want to protect themselves and their families and those around them in their communities, and so they'll self-quarantine, and then you can check on them, and then you can test them 14 days later to double check that they didn't have the virus from the first test. It's not complicated. It can be done. It's just, again, a failure of imagination and a failure of our current government leaders to simply enact the scientifically understood principles and proven strategies that have been done in other countries. So the last two are quarantine and isolation centers. Basically, it doesn't work to have people who test positive to go home and infect all of their families who test negative, because then they end up spreading the virus exponentially. It's really that simple. We'll talk more about that, but I guarantee, like, most people don't want to infect their families and potentially kill their loved ones. They would rather go to an isolation center where they are able to, get better with help and treatment immediately upon needing it, instead of being stuck at home, not knowing whether to go to the hospital, and then having being too late, so your symptoms are much worse. The difference between Italy, right, where they had no infrastructure in place, nowhere to prevent people from going to the hospitals. Everyone just go to the hospitals. Your hallways are completely overrun, and you basically end up with 10% death rates, right? Whereas you look at South Korea, where they had a full infrastructure to divert people away from the hospitals and put them in isolation and quarantine centers. And when they're in the isolation and quarantine centers, if they get sick, they immediately get help, right? They immediately get treatment. They immediately get support for recovering. And their death rates were 0.5%, right? 10% death rates, no infrastructure. 0.5% death rates, infrastructure where you're helping support people heal. So not only are you saving the lives of your family and your community by not isolating yourself at home with your family and instead going to an isolation center, you're also increasing your probability and the probability of other people with the disease from getting sick, because you can get treatment and get support quicker and faster. So the model they used in South Korea was much better on many, many levels. Okay, so there's only 3 more points of um, vocabulary that we use. So one is quarantine, and the other is isolation and triage. So quarantine and isolation are similar, but they're very, very different. Quarantine means that you don't know if you're sick. If you are quarantined, you have no idea if you're sick or not, and basically you have people who are sick and are not sick in the same area, right? That would be a quarantine. And typically a quarantine you can't leave for whatever reason if it's really a quarantine. Otherwise, it's like a stay-at-home order or a voluntary quarantine or whatever. Isolation is where you're tested or you're clinically diagnosed if you don't have direct testing, and you know you have your doctor has told you that you have coronavirus, and then you're isolated separate from the normal population that may not have coronavirus. So isolation is what stops the coronavirus in its tracks. Isolation is the foundation to the science that solves this problem. If you're only quarantining people together, sick people and well people, you're mixing them, that is a mitigation model because the virus continues to spread. When you test someone or you clinically diagnose them and you know that they have the virus, the doctor says, okay, this person has the virus, they have all the symptoms, they have the virus. Then you isolate them away from anyone who might not have the virus, and then you stop the spread. It's a simple concept, and it's very important to understand that 100% of all those who test positive for the virus need to be isolated. It's perfectly fine, or not perfectly fine, but is, especially in democratic countries, if an entire family chooses to be infected together, you technically could self-isolate at home, but they should not be leaving the house. And if anytime they did so, they would wear a mask over or anything over cover their mouth and their nose. Right now, doctors in the United States are telling people who have the virus that it's okay to leave their house and go on walks and do other things, even without covering their face and their nose. It's insane. So, yeah, I don't even know what to say about that. But isolation, super key. Triage. Triage is basically, 10 to 20% of those who get infected need to go to the hospital and get direct help. And that's basically right behind the front lines, but is super duper 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 important. And that's where you end up, people who need oxygen respirators is about, 2 to 5% of them, and then the death rate is 1 to 2% or up to 2.5%. So it's really important to be supporting the triage workers. And we use the term triage just because technically once you are wounded in battle, you're no longer at the front lines, and you're typically not spreading the virus because everybody knows you're infected and are working around the clock to make sure you don't spread it. And if you do spread it, you're probably not going to be spreading it to very many people because everybody around you is wearing protective equipment and trying to prevent the spread. So we're not necessarily super worried about the spread of the virus inside the hospitals because most people either already have the virus or are wearing full protective equipment. So in terms of the front lines of the spread of the virus, we consider the triage to be an essential component, but not the front lines because there's very small risk of spreading of the virus exponentially inside the triage hospitals. There is a significant amount of healthcare professionals who do get the virus, which is extremely unfortunate, and that's why we need to get as much supply chain manufacturing supporting them. And that is part of the delivery models that we're losing, and it needs to be global. We need to be coordinating global supply delivery chains across the world. It doesn't matter if the United States isn't asking or wanting help from across the world. The world needs to help the United States now and Europe anyways. Europe is taking help from China and other places. The United States, on a federal level, is a disaster area. I don't even want to get into the politics of it. But the world just needs to go directly to the states, directly to the local communities, send supplies, and help immediately because there's not enough masks, there's not enough ventilators, there's not enough protective equipment, full body protective equipment, there's not enough gloves, there's not enough any of it, swabs, all of it. We need more of all of it. So to wait for asking, for a country to ask for help is not okay in this time. The world just directly helps. You just come in and you help, and you demand that the supplies get to the states that need it. You do not ask for permission. There is no requirement to get approval or disapproval to save lives. Right? If they did not approve the shipments to come into the country to save lives, that would be against the Declaration of Human Rights and against, and would basically be, uh, a crime, a war crime. Like, it's just not acceptable to be preventing the needed supply and materials to get to the triage and help all of the people where it's needed most. And remember, if we look at the projection and the data here, China came and went, South Korea came and went, and Iran is getting better, but it's still there. Then Europe is just exploding, and now it's going into the North America, right? So we need to get the supplies to Europe and to Americas right now, to North Americas right now. But you can see how in South America it's starting up, right? And it's slowly percolating into some of Africa and the Middle East here. And so in Middle East is hit even more. So it's almost like America, Middle East, and then Africa, South America, then Africa. So we need to be preparing to get the supplies into the correct location across the world when it's needed, because each country won't be able to handle the mass death rates and spikes in the hospital system by themselves. And if they don't ask for help, we help the world anyways, okay? Because it's not about the nation states and the governments, it's about the people and our human values across the world, which requires us to help. All right, so let's go into the plan itself. There are 13 steps. We're going to go through each step. We're going to explain it in detail, and we will be available on conference calls. We will be available by email. We will be available on Facebook. We will be available on Twitter. We will be available wherever you need to communicate with us and build this team to support any country, any community, to help implement a suppression model to stop the coronavirus globally immediately, to save tens of millions of lives, if not more. Step one, organize, right? That's basically what I was just saying. Organize, bring the people together, work together, empower each other, educate each other. Do not sit around waiting for your government to do everything for you. If they were going to do that, there would not be exponential growth across the world, because they already would have solved the problem, because the science is already there and we already know how to solve the problem. And the global leaders and the leaders of many, many Western countries didn't do it and are not going to do it. So we have to do it. Contact your representatives constantly. Call them once, call them twice, call them as many times as necessary until they enact suppression measures, until they protect all of the frontline workers, including the supply chain workers, including all of the workers who are bringing food, right, and making sure they're protected, that they're tested, and that they are not going to be getting sick, and that when the public goes to interact with these businesses, that you're not scared of getting sick with the virus, because those businesses are actually suppressing and stopping the virus. It's in the business's best interest. It's in the public's best interest. It's in everyone's best interest to organize and ensure that everything's moving forward, regardless whether or not the government is mandating these requirements. This is science. Follow the science, not your government. Work with the governments to help move it all forward in a good way, but don't rely on them. Educate yourself, work with your community and the people across the entire world. Okay? Again, even if you don't have government permission, like let's say you set up a temperature checkpoint or whatever at your grocery store, and you don't have legal authority to stop people, right? It's perfectly fine, because the goal of stopping the virus globally is not to get every single individual person. It's just to get like 90%. Like 80-90% is enough. Less than 10% of the population will be like, we're not going to follow these guidelines. We're not going to, do this, right? Very, very few people are going to know they have symptoms. Oh, I have a fever, but screw it. I'm not going to go to a fever clinic. I'm not going to go get, make sure that I get tested or whatever. Very, very few people are going to ignore the advice of the scientists and ignore the advice of someone telling them that they have a fever, right? The vast majority of people will just follow the recommendations. And that will be enough already to stop the virus, because if a very small number of people just ignore the recommendations and are not forced to do it, it won't allow the virus to continue to grow exponentially, because it will peter itself out, because most people will follow the advice. All right, number 2, self-quarantine immediately unless you're on the frontline workers or triage. Everyone basically, if you can't get tested, right, you shouldn't be leaving your house. You shouldn't be interacting with people across the world unless you're a frontline worker. If you are a frontline worker, you cover your nose and your mouth always whenever you're in public, whenever you're interacting with anybody, right? Because this is an aerosol, spread. It spreads from talking and breathing. You don't even need to sneeze and cough, and it's still going to spread, right? So when you're outside, we would still recommend everybody's wearing the face mask and to cover their nose and their mouth, primarily because 50% of the population that has the virus doesn't know they have it. And if everybody wears something over their nose, their mouth, then it's easier for all the people who don't think that they have the virus but do have the virus, or for the people who know they have the virus but don't want to look weird in public, to also cover their nose and their mouth, right? So just self-quarantine, be smart, and try not to go indoors in any types of crowds or where you're near anybody. Stay as far away as possible. Step 3, stop all travel immediately until testing is available. Mostly metropolitan areas. So if you are in an overall area where you have some, roads coming in, you could put some, temporary checkpoints on the road, ideally with the support of the government. But if you have a very small government, or you basically could do what you want in your own village or your own community. You could ask people coming into your town, or at least during daylight hours, get most of the people to do a temperature check before they come in. If they have a fever, tell them to cover their nose and their mouth, regardless of whether they have the fever or not, but then have them go home and self-isolate or quarantine if they do have a fever, right? A lot of people won't even know that they have a fever. So you do the travel bans to just stop the spread, right? Ideally, the governments, pressure your governments, tell all the governments to stop travel. Travel is perfectly okay as soon as there's testing available, right? And remember, we can also do the blood testing now. We can add that here, do mass blood testing in addition to RNA testing for the antibodies, so mass antibody testing. So it shouldn't be that difficult to get your governments to do the travel, because it will protect your economy. It'll allow people to travel, and basically you're preventing the spread of the virus. Like, what could be better for your country? It's what China's doing. It's what South Korea is doing. The planes come in, they check them out, they test people, they put people on self-quarantine and or isolation if they test positive, and then that's it. And the virus doesn't spread. And then the economy's open and people can travel. I mean, this is not anything complicated. So stop all travel until testing is available. Step 4, immediately recruit and pay all frontline workers bonuses during the pandemic. We must recruit and support the frontline workers, because some of them are going to get sick, right? And we need to recruit to back them up. And it will go over more for the delivery services, but for expanding, you need to expand and hire more people. We also need to build the infrastructure for all of the tracking and tracing and isolation centers, and all this stuff needs to be built. It's infrastructure that needs to be built. So therefore, you need to hire a lot of people. People are out of work. They're sitting at home. They need jobs. So hire them, get them functional, and then test them and make sure they cover their nose and their mouth always when interacting in public. So that's immediately recruit and pay all frontline workers bonuses during the pandemic. If we need to, we can create For governments or places where they won't give bonuses to frontline workers, we can create some type of um, digital currency or organizational equity that could be distributed to people who do work. So track your hours. If you're not getting bonuses, track your hours. We are happy to provide value in the form of tokens and other digital valuable commodities that can help alleviate locations where they don't give bonuses that are sufficient. All right, number 5. Build up and subsidize expanded delivery services. This is really the backbone to ensuring that our supply chain doesn't collapse and fail. Most importantly, it's about making sure that all businesses and all workers involved in the supply chain, involved in delivery of essential food, medicine, and other core components of the society, cover their nose and their mouth at all times. Make sure that they're cleaning and washing and making sure that they're sanitizing and that they're not passing on the virus to their coworkers and getting tested. So, other than that, we just need to drastically expand delivery services. This should not just be up to the businesses to decide, oh, we don't want to expand, we're perfectly fine. The community needs to demand the expansion because otherwise people won't get fed and get the food delivered and will have to go to the grocery store to interact. Like even here, it's like you can't get delivery because the expansion hasn't happened for over a month now. And they are trying to hire hundreds of thousands of people, but then people don't really want to go work in these locations because they're not safe, because people aren't covering their nose and their mouth, and they're spreading the virus to the workers in the grocery stores and in the supply chain. You can see with Amazon, people are getting infected in Amazon warehouses all over the world because so many people are working there and they're such close quarters and they're not covering their face and their mouth, which is a huge problem, and that just needs to change. And we need to support and expand all the delivery services globally. I don't know what else to say about it. Like when I talk about expanding, like if people who are billionaires should be investing, hundreds of millions of dollars or whatever they need to do to expand these services. Whether the governments are investing in them, whatever. Delivery services just need to be expanded. Supply chain services need to be expanded, and it needs to happen immediately. All right, step 6. Test, trace, track, treat, repeat. All right, so test. And again, just keep testing. No travel without testing. And then whenever someone tests positive, you need to trace and track all of their contacts and communicate with them and make sure they all get tested. Right? That's the foundational science behind stopping the virus. Even after you reopen your economy, if someone gets tested positive, you trace all of their contacts, you track all of their contacts, test all of their contacts again, and then trace and track all of the other people who become positive. That's how they stopped it in South Korea without closing down a single unnecessary business, right? They closed down minimal businesses, and they closed down. They didn't even have to stick people in their homes, right? Because you do the testing, the tracing, the tracking, and the treating, and you repeat. Like, it's not complicated. It's just manpower, right? You do need to hire millions of people, typically in groups of 5. You have little teams of 5. So let's say we hire 5 million people, right? So we want to hire 5 million people. That'll allow us to trace and track 1 million positive cases of coronavirus, right? With 5 million people who are hired. So that just needs to happen immediately because it's so important. I don't know how to emphasize that enough. Anywhere that's not doing that is basically, it's the number one thing that's scientifically proven to be able to stop the coronavirus in its tracks and ensure that you don't need to close down your economy, right? That's how you do it. You test, you treat, you track, you trace, and you repeat. Test, trace, track, treat, repeat. Over and over and over again. I could just go on and on about that, but and remember, we can do the massive quantities, tens of millions, if not hundreds of millions, of testing using the blood test with the antibodies. So there's really no excuse to not be doing this in mass quantities across the world. But there's almost no point in testing if you don't also trace and track all their contacts and test everybody who they came in contact with. Because if you don't do that, you're not stopping the virus. If you do that, not only do you stop the virus, you don't have to close down your economy because you can get ahead of the exponential curve. So I'm going to stop there, but like I can't emphasize how important that step is. Um, Even after you restart your economy after mitigation, that's the most important step to stop the virus. So I'm going to stop there and go on to step 7. Immediately set up fever checkpoints everywhere. So every single grocery store front, every single pharmacy front, every single location where anyone's going inside in relationship to public interaction must have a fever checkpoint if you want to stop the virus. You can also do this voluntarily. You can ask everybody to check their fever, their temperature before going out in public. So people could all have their own thermometers, and when you show up somewhere, you pop your thermometer and you tell them and you show them that, look, I don't have a temperature because I already checked my own temperature, right? So whether you have front door, checking using the non-touch method, or whether people are doing their own temperature or whatever it is, basically everyone needs a thermometer or access to a thermometer anytime they're interacting in public. I think it's like somewhere between like half to as much as 80% of those with symptoms have have a fever. So it's a great way to slow down the virus. It also makes people remind them and think. And at the checkpoint, you can remind people to cover their nose and their mouth. So no checkpoint, then people aren't going to cover their nose and mouth, and they're not going to check their fever, and then they're going to spread the virus. Like I don't know how else to say it. It's simple. Businesses can easily do that. If you have to hire millions of extra people to stand in front of every single business, that is a good thing because people need jobs, right? If they can cover their face and their mouth, their nose, then they're going to be protected, right? It's not it doesn't need to be a scary job. It can be pretty safe, right? Because most of the people are not going to have the virus. This is not a hospital. It is just a checkpoint. All right, number 8, alternative testing methods without actual coronavirus tests. So there's going to be a lot of locations in the world that don't have coronavirus testing. So again, there's the direct RNA testing, which uses all the chemical reagents and is more complicated and more costly and has a lot more limiting factors, so it's hard to do in bulk. And then there's the blood test, which you can do massive bulk, tens of millions, if not hundreds of millions, all can be set up at once. Both of those tests are great for checking for either antibodies or the actual virus. But even that might not be possible in some locations that need to do this quicker. So in that case, there are many different ways you can test, including the temperature check, right, and test your temperature. You can also do basically test for the flu, right? If they don't have the flu, the probability that they have flu-like symptoms during a pandemic and that it's not something besides coronavirus is like very, very low. So it's a great way to at least get a high to stop the exponential growth, because it'll have very few cases getting through, and as long as everyone else is covering their nose and their mouth, it should reduce the spread of the virus so that it's not going out exponentially. From there, you can also take x-rays of the chest because you can see some of the pneumonia, and you can also do pneumonia blood tests and things like that. So there are other tests that they do. Just look up on Google, what they did at fever clinics in China, in Hong Kong, and South Korea. Like they'll have, there's tons of information of how they use alternative testing methods, and it's specifically called when a doctor makes a diagnosis that is without a direct test, it's still a diagnosis, and you still and as much as like a third or more of all of the diagnoses in China were clinical diagnoses where they did not actually directly test for the virus. So it's definitely possible in your community, if you don't have testing, to still have alternative models of determining whether someone has the disease and the virus. So don't. That's not an excuse. To not have a direct test is simply not an excuse to allow the virus to spread without any, isolation and quarantine and covering nose and mouth of the public. All right, step 9, setting up pandemic fever clinics, including drive-through testing. Most people should already know about this, but it's pretty simple. You just need to have physical locations. They don't need to be big. You can, if you do the drive-through testing, you can have the lines of people in their cars. You don't have to have people get out of their cars, and then and even ideally, you could do the testing and pick up at home or a lab. People could just do it at home if they do their swabs and then send it in the mail or whatever. Eventually, that'll come. So at the fever clinics, everyone needs to cover their nose and their mouth, right? And then you just need to set up time slots of people. You can give out numbers. That's a great thing at grocery stores too. You give out numbers so that people are not all standing in line. Lines should just be outlawed everywhere across the world. Don't do lines. Instead, hand out numbers and then call people's numbers so that they don't have to stand in line and spread the virus. And make sure people are covering their nose and their mouth. Once you have the fever clinics, ideally before at the same time you're setting up step 10, the isolation centers. So if you're testing everybody and you test them and tell them they're positive and they just go home, that means that they are just basically transmitting the virus to their family. That's not good. So you want to set up your isolation centers so that people do test positive, that they go to the isolation center and stop spreading the virus to everyone else. Furthermore, at the isolation centers, they can get direct support and help at any moment if they get worse, and they can make sure that they are able to get to immediately get help. The sooner you get help, the sooner you're not waiting at home to go to the hospital, the better you'll recover, based on the data in South Korea, where they treated people early, both within the isolation centers and other components. We want to stop all public interaction as much as possible. Support delivery, shutdowns, like just making sure people can reduce their relationships in the context of going out and interacting with people. You could even do things as simple as like, okay, if your address ends in an even number or an odd number, then during even number hours from 2 o'clock, if you're an even number house, you go out on a walk. If you're an odd house on odd one at 3 o'clock, you can go on a walk, right? So the point is just stagger, reduce the amount of people in any one place at any one time, cover your nose and your mouth. There's no amount of people that can be in one place at the same time. Any place that says, oh, it's fine to have 10 people, oh, it's fine to have 200 people, oh, it's fine to have whatever number of people, it's incorrect information. There is no number of people that it's okay to spread the virus to, right? If you want to bring people together and they want to travel, that's fine. They get tested, and so that everybody there is very low probability of having the virus, then the virus can't spread. That's how you have gatherings, right? The economy can restart because everyone's tested, done. And we can do this globally. We can have billions of tests available globally if people just work at it. There's no easier way to manufacture anything besides tests, right? There literally is no easier thing to manufacture. We're going to be making billions and billions of masks, billions and billions of gloves, billions of protective equipments, including all these things. And to make billions of tests is easier than making billions of masks and shipping them across the world. Making billions of tests is the easiest way to stop the virus. All right, so stopping public interaction, super key. Anywhere you have to have public interaction, cover the nose and the mouth. Step 12, find locations and set up quarantine isolation centers early. Don't wait to have quarantine and isolation centers. Get them set up early. I do also want to go over, I think we still have this. Let's see. Should be here. Here it is. So we don't really know the best way to talk about the coronavirus structure for the care. But this is just like a general idea, so we'll just throw that out there. So we basically went through the whole plan. It included, the quarantine, the isolation centers. You have the hospitals. You're trying to divert from the hospitals, but people get sick and eventually have to go there. So all those are different components. And so we created a list that kind of goes through, from the bottom to the top of all of the different levels. And there's about, 10 different levels to consider. At the hospital, the very top level is the ICU bed where you're getting on ventilators and other, emergency urgent care to basically save people's lives. The ICU beds fill up. At that point, once they fill up, you basically have to decide who's going to die and who's not. This is already happening. Um, a lot of places, if you're above a certain age, they basically just let you die. And then people who are younger, they have a higher probability of surviving on the ICU beds and the ventilators. So it's horrible, horrible, horrible. Um, Also, while we're on the topic of whether people die or people don't die, it's important to note that our model for stopping coronavirus global in the suppression model and building the infrastructure to actually suppress and stop the spread of the virus does imply that you're not focusing on keeping current people with the virus alive, right? That our focus is on the exponential growth, right? If you can stop the exponential growth, even though there may be a little bit less time of our time, while other people are focusing on keeping the current people alive who have the virus, if we stop the exponential growth, then we will be saving tens of millions of lives as opposed to just a couple thousand lives by focusing on people in the hospital now. So we're not saying that people should be focusing on the hospitals and saving people's lives there. We're just saying that we also must have people stopping the exponential growth of the virus because there's nothing scientifically proven to save more lives than that. Although those lives are saved in the future, not the present. All right. After the ICU beds, you have high-level care, right? Beds in hallways, non-ICU hospice. People who can't get into ICU beds basically end up in hallways or end up in a high-level care or hospice where they, don't have access to the medical facilities that they need to potentially survive. So there's some type of high-level care where it's like, super emergency, super problematic, constant round-the-clock care, but they're not necessarily ICU beds, both because the ICU beds just run out and because you have people who may not need the ICU beds yet. And then you have regular hospital care. So this is the third level of regular hospital care, which is basically non-emergency. They still need significant care, and there might be people still in hallways, etc. But they're in the hospital, and it's like regular hospital care. And there could be regular hospital beds that are expanded into other buildings or other locations, because but it's still with significant amount of care at those locations. So this is the next level. We're not totally sure about it, but the idea is that there's some type of minimal support facility where you have kind of like a rehab or prehab location where after people are no longer super sick and needing direct constant care in the hospital, maybe there's a rehab facility that's more of a minimal care. They're sick, they're not getting up and moving around a lot, but they can basically care for themselves. They have symptoms. They don't need constant care at a hospital per se. But there's still a nurse on duty coming by and checking on people at regular intervals. So that may be something that's not necessarily a normal hospital, but maybe it's something in between a hospital and isolation center. In the model that we're using, the isolation centers, which is the next level, there is no care, right? Everybody is not being checked up on by any type of nurse. There may be a nurse present for people who deteriorate quickly, but in an isolation center, you can basically move around, you can dance, you can feed yourself. You may not even have symptoms at all. You don't need care in any way whatsoever at an isolation center. If someone at an isolation center does decay and get worse very quickly, at isolation centers there would be access to help and treatment immediately for someone who needs it. And then they're quickly moved to a prehab center where you have minimal support care or taken to the hospital or to a place where there is significant care, depending on their situation. So basically, that is like the overall model for between the isolation centers with no care, the rehab prehab with minimal care, regular hospital, significant care, high level care, beds, hallways, non ICU hospice, which is basically constant care, and then you have ICU beds, which is the highest level of care. Um, just so you have some numbers, like from what we're getting, is that as many as 50% of people in ICU beds still die. But if you are somebody who is in that situation and need a ventilator, you know, if you're going to be dying anyways, getting on a ICU bed and getting that type of care will double your probability of surviving. It will basically give you a 50-50 shot of surviving, which is much better than definitely dying. So we want as many ICU beds as possible. We want manufacturing of ventilators to be expanded. We want them distributed across the world to the locations that are needed. And then once those locations are done using them, we want to redistribute them to other places of the world because other places are going to need them afterwards. And so that needs to be coordinated globally. And we just need to make sure that people understand that that's just what's going to happen, that it's not up to any particular, government or whatever to decide where and how the uh, ventilators or equipment needs to be used. That's up to the scientists to know and just make sure that the distribution is happening properly and that the people just distribute it. You don't need to ask for permission. You just make sure that the materials get to where they need to go. So after the isolation centers, everything else, there's just no care. So people who are working in isolation centers, quarantine centers, help centers, fever clinics, testing checkpoints, temperature checkpoints. I mean, you don't need to necessarily have high level skills. The most high level skill would be the actual fever clinic, respiratory clinic, because they're going to be testing people. And so there's a scientific and nurse and doctor aspect of it to do diagnoses. But other than that, you all of these other, you could, we just need millions of volunteers to help set up these locations and to man them and operate them. So again, isolation centers, quarantine centers, you don't need any care. Nobody is typically is sick off these isolation centers. People may have symptoms. Quarantine centers, typically you don't have symptoms because you don't know if you're sick or not. If you did know someone was sick in a quarantine center, you'd send them to the isolation center. Health centers is an idea that we had in terms of like, what if there's someone sick at your house and they're self-isolating with the disease and you just don't know where to go? And so you don't want to stay home because you know someone has coronavirus at home, but you don't want to go to isolation center, you don't want to go to quarantine center. The idea of a help center is that anyone can go to a help center. So a help center is basically just like, food, place to sleep, a place to get information, educated support, to get where you need to go, regardless of whether or not you're sick. If you have a lot of people who definitely test negative, but they can't go home or they have nowhere to go, there should be locations where they can stay that will prevent them from getting the virus. They should not have to go to an isolation center or quarantine center if you know that they don't have the virus. So that's a help center. Basically, the idea of a help center is that if you don't know where else to go, you go to the help center and you get help, right? You don't have symptoms, but you can't go home, or you don't know where to go, or whatever, boom, help center. During the pandemic, it may be helpful for a lot of people. Fever clinic, respiratory clinic, drive-throughs, basically you're waiting for your results. Typically, if you don't get your results right away and you need to wait overnight, you would go to a quarantine center as opposed to back home if you're waiting for your results. But yeah, that's it. So the testing checkpoints would primarily be long distance travel, like at airports or freeways, interstate when you're changing states or counties. You would or metropolitan areas. There might be a checkpoint that's basically like, have you been tested? Do you have a fever? Before you start traveling long distances and transmitting the virus to other locations across the world. And then lastly, the temperature checkpoints is more of the local travel in front of every business. Whenever you go indoors, you just always do the temperature checkpoints. So that's basically the infrastructure that has to be built. To build this infrastructure, again, all of it is basically separate from the hospital. A lot of hospitals are even moving all of their existing patients to a separate hospital and then making some hospitals 100% coronavirus hospitals. So basically, you're building an entire infrastructure. Some other hospitals will actually build physical walls between the coronavirus wings and the non-coronavirus wings so that there's literally a physical separation and that there's no interaction between the doctors or anyone. You actually have to go outside and come back around to another location to get to the other side of the hospital. So basically, the infrastructure that needs to be built is specific. It is clear. It creates these levels of support for people who are sick, so that most countries, including here, if I'm sick right now, my only option is going to the hospital. There's nowhere else to go besides the hospital, right? So when you look at what South Korea did or China did, there's this infrastructure of levels, right? Almost like 7, 8 levels where people get the support and help to divert them away from the hospital to get the support they need, to get the health care they need, to get the treatment they need without having to end up in the hospital and completely overwhelm the hospitals. It's significant. If we built this infrastructure across the entire world, the infrastructure itself would be most likely the fastest, largest infrastructure build in the history of humanity, but that's what's necessary to stop the coronavirus. And it's also going to be good for the economy, right? By just sitting around waiting for people to die and having no, places for them to go and overwhelming all the hospitals and not building any infrastructure, that's not good for the economy, right? We know we need all this stuff. So by bringing the whole world together, by getting people and hiring them to build this infrastructure, that will actually improve the economy because you will get people working and actively interacting with the infrastructure projects, which is work and pay, right? Let's get people paid and actively engaged in building this infrastructure across the world. This will not only help us now to save tens of millions of lives, it will help us in the future for the next pandemic, which is coming, including this one where the coronavirus could easily mutate and then restart all over again. All right, so I think that pretty much covers the care structures. There's one last component of the plan, which is the economic recovery plan. So the economic recovery plan is extremely important. All right, so whether we're talking about tens of thousands, hundreds of thousands, or even millions of people dying, if not tens of millions, it creates an economic disaster area. Like anyone who's talking about, like, let's just reopen the countries and have everybody interact and go to churches and do whatever without testing and without tracing and tracking and treating people who are sick and just allowing the virus to go rampant, it'll create a sense of fear and horror watching everyone die around you. No one's going to want to go out and interact and buy things. Nobody's going to want to go to work if they're putting their life and their family's life at risk. It doesn't work. The way to get the economy back up and running quickly is to stop mitigating the virus and to start suppressing it. You suppress the virus, you follow these 13 steps, you follow the steps of the scientifically proven models in China where they have reopened their economy and have stopped the virus. In Hong Kong, that didn't even have to close down their economy to begin with, and they stopped the virus, right? And then we do that across the entire world, and then we reopen the economy, and it would take 2 weeks. 2 weeks to reopen the entire economy as long as there's testing, right? And as long as people are covering their nose and their mouth. It's not complicated. It's science, and it's not cultural. It's not like, oh, only Asian people can cover their nose and their mouth. No, that is just nonsense. It's science. We cover our nose and our mouth because we know, factually and scientifically based, that the virus can be transmitted from talking and from breathing. As an aerosol form, it's not airborne virus, it's vapor and small vapor droplets that float in the air. And when you're talking and you are breathing, and obviously coughing and sneezing, you transmit the virus. Therefore, you cover your nose and your mouth. It has nothing to do with culture. It has to do with science. And we do it globally, right? It doesn't matter what you cover your nose and your mouth with. You do it with a tissue, with a rubber band. You can do it with a t-shirt or a cloth or a bandana or if you have a mask, right, cover up your nose and your mouth. Not complicated. That is the number one thing to restart the economy along with the testing. All right? It's essential that we focus our testing and the protective equipment, specifically covering your nose and your mouth, for frontline workers, for delivery workers, for the backbone of the supply chain, including the Amazon workers, all of that, essential. If we don't do that, the supply chain can and will collapse. If they can't get enough workers to work because they're sick, or no one wants to work because they're scared for their lives in these industrial warehouses, in the supply chain, in the food chain, in the field, wherever, to meet people's basic life needs, the food systems and the supply chain systems for the medicines will collapse if they're not supported now. And then instead of tens of millions of people dying, hundreds of millions of people will die, if not a billion or more. Because if our entire societal system of supply chains collapses, it's over. All right? Not good. And instead of taking years or a decade or more to recover from this pandemic, it could take much longer, right? So the quicker we stop the virus and use the suppression model instead of just mitigating it and allowing it to, mitigation allows it to grow exponentially, right? Still don't have these up. Stopping the virus using the suppression technique will actually bring it down exponentially, okay? All right, anyone who says we cannot build this new infrastructure in Western third world countries is just giving up and letting the virus win. It's a failure of imagination. The leadership in the West, right, the old leaders of the world have failed. They have not understood or imagined the severity or the ability for our society to respond and to actively enact the proven scientific models that we know will work, right? But we can change that, and we can support and work with the Asian models that solve this problem, and we implement it now because there's no reason to wait. We just do it, okay? We must actually, if we don't have testing, right, then people need to stay indoors and wait for the testing, right? Once we have the testing, we can restart the economy immediately. Again, the easiest way to get the testing out in mass bulk is the antibody tests. Let's do a little research just to show this. So UK antibody tests, I think it was like 3.5 million. UK says 3.5 million tests for virus exposure will be available within days, right? Let's see if that really says days. 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 Not weeks, not months, days, right? These are testing kits that will allow any doctor, right, any clinic to quickly test to see if someone has the antibodies, and to, it'll be 14 days lag time, but there is no reason not to do the testing now that we know that we can do tens of millions, if not billions, of these tests all across the world, right? Hundreds of millions of tests can be created in days, all right? And that will get our economy back up and running, because every single worker that's working in the supply chain, right, you simply get tested, right? You want to go to a bar? You have 50 people want to go to a bar? You all get tested, right? The bartenders all get tested? Go to the bar. No problem with that. Go enjoy your lives, go to the bar, restart the economy, done. The virus has stopped. We don't have to worry about it. It's that simple, right? You want to travel? You want to get on a plane and go travel somewhere? You get tested, done. The virus doesn't get spreaded, right? Wear something over your nose and your mouth just to make sure. But as soon as you get the testing going, as soon as you trace and track everybody who gets a positive result, your economy can restart in weeks, not months, right? Again, let's remind ourselves how this worked for China. China, boom, one day in the purple, one day, right? Blue, 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 purple, February 13th, right? Blue, 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 right? Then you look at South Korea, purple for maybe like a week, right? South Korea, purple, a week. Maybe less than a week, maybe like 5 or 6 days. And then blue, 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 gone. Then you have Europe, right? Italy, boom, purple. March 6th, still purple, still purple, darker purple, even more darker purple, and more dark purple. Weeks and weeks and weeks. It will last months. The mitigation model will just have months and months of death and destruction, and eventually it'll collapse the supply chain because the workers won't be protected because they're not wearing masks and covering their nose and their mouth because they're not getting tested to make sure that they're not spreading it with their coworkers, and then they won't have delivery drivers and they won't have Amazon workers in the warehouses because the whole supply chain will collapse and then even more people will die, right? So this is not about economy or non-economy. This is about science and just following the proven models that already exist. I don't know how to say it any other way. It's just a failure of imagination of the leaders of the West who happen to be the ones who were in charge of the world before. You know, they had the most money, they had the most control over like global supply chains and and the banks, right? The leadership of the West has failed, failure of imagination, and we just need to get over that, acknowledge and understand that the Asian cultures are leading the way into the future of humanity's existence on this planet, and now is the time to support that and acknowledge that and allow them to help the world in a way that is just essential at this time of need, right? Let's just do it. It saves tens of millions of lives and it will improve all aspects of the economy globally, and it takes weeks instead of months and months and months. Like there's no end. There's no end to the disaster in Europe. There's no end to the disaster in North America. And it's just going to get worse in other countries of the world that are doing the mitigation model instead of the suppression model. You know, yeah, I mean, let's see. Italy starts March 6th and it is March 26th, 20 days in Italy. China had 1 day, right? Italy and Europe are going on 20 days. All right, let's see if there's anything else here in the plan. Restart the economy. Simple version was transforming the economy into a coronavirus economy. Hire mass amounts of people to deliver food in the frontline work, including fever clinics, isolation centers, quarantine centers. Just it's the tip of the iceberg. There's so many people you can hire in the existing economy itself of the coronavirus to make the economy function even better. Test all frontline workers, minimum weekly, twice a week if, for triage. Test, 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 test. Super key. Otherwise, they will spread it to themselves, and then they will all get sick, and then the next thing you know, your frontline workers aren't functioning anymore, and your supply chain can go down. Traveling will be more difficult, but as long as you're tested, you can travel. So as soon as you get your testing checkpoints up at your travel locations, like airports and state boundaries and things like that, you can start traveling. You know, it's not a problem. And once you get your traveling backing up, your economy is going to get backing up real quick too. The suppression model will let the economy get back up running again in weeks instead of months or years. The last thing we want is repeated cycles of virus outbreaks. And the only way you stop that is allow the economy to get back up to normal through mass testing and checkpoints. It's scientifically proven. Like having a fever checkpoint is not some draconian thing that is like horrible and awful. Oh, that only happens in Asian countries. No. What's draconian is locking everybody in their houses and telling them they can't go to the grocery store without risking their lives of themselves and their families. And so people are scared to even get food or order food for takeout, right? Over dozens and dozens of restaurants who are takeout restaurants, right, closing because people are scared to buy food for takeout, right? That is draconian. That is a nightmare, right? Having your employees get tested for fever, right, before they go to work, covering your nose and your mouth, right, doing testing so that the public knows that when they go to that restaurant and get takeout or when they go to the grocery store and get their food, that they're not going to get the virus, right? That is civilization, right? That is a society functioning normally locking everybody in their houses and telling them not to leave, or they're going to be scared to go out and get the virus, or telling everyone to, don't worry about it, just go out and get the virus, it's not going to work either. Neither of those models work, right? And they're extremely draconian, right? So the model that works is covering your nose and your mouth with whatever you can find, testing the workers, doing the temperature check for all the workers, doing the temperature check for anyone who goes indoors at your location, whether it's a grocery store, a pharmacy, or a restaurant, or wherever, to pick up food, right? Then the public can start to, in a couple weeks, have massive exponential decrease in cases in just 2 weeks, and then, like they had in South Korea and in China, and then you can have confidence in the economy. You can have confidence in your ability to buy food and to get your needs met, and that is what will jumpstart your economy again. And right now, we're just all sitting around waiting in this mitigation model, allowing China's economy to take over, China and Asian countries to take over because they're functioning and we're not. And we're not going to be until we actually follow their lead. Or it's going to be a year until we get all the vaccines and other things, and with a year of just like mass deaths and a whole months and years of like a month and a year of like months and or a year of the hospitals being overrun. It is out of control. Lastly, and also essential to move our economy models, we want to get restarted towards the planetary friendly economics. All right, so that's part of our conclusion. Solving the problems of coronavirus go directly in relationship to solving all other global crises and problems. Let's start with the health example. All right, so we're getting in our conclusion. We're finishing up right now. Thank you. If you did watch this whole thing, call your congresspeople, call your government representatives, step up in your community, become a leader, do the right thing, save millions of lives. Wear a mask on your nose and your mouth as much as you possibly can, or whatever, to cover your nose and your mouth whenever you're out in public, especially indoors. All right, so we're going to go through the evaluation. Okay, really quick before we go into our conclusion, we could talk about how to apply this travesty to improving other aspects of societal life. I really quickly want to show our evaluation models because they are really helpful. Both governments and businesses typically don't change unless or until you explain to them what they need to do and compare them to other businesses and groups that are making those changes, right? So we have two types of evaluations. We have the business and the government. Let's start with the business. The business is nice because even if the governments do nothing, the businesses can massively transform our ability to stop the coronavirus. So a couple things here. Communications. You want to make sure that your business is communicating well with the authorities and your employees, and making sure they understand how it affects the customers and everything. You want everything to be communicated well. Super key. Testing. You need to have your employees getting testing. They need to be doing temperature checks. They need to be doing the blood testing or the direct RNA testing, and that is what it takes to protect your workers, right? They also, well, we'll get into that in a bit. So temperature check to the door. All customers need to have a temperature check to the door, right? You need to basically ask them not to come in if they have a temperature or if they're not covering their nose or their mouth. We'll talk about that more. Also, if you're going to continue your employees during the pandemic, they need to regularly get tested, not just once. And the governments and the hospitals need to be prioritizing testing frontline workers, especially supply chain workers, because if the supply chain falls apart, bad. It's all over. Benefits and leave. All workers should be getting bonuses. Frontline workers should be getting bonuses. They should be getting ability to stay home if they want to, getting sick leave. They should get support if they do get the coronavirus, and making sure that you're hiring more people to back up if people do get sick, that you have someone to replace them. Cleaning and sanitation. You need to disinfect and sanitize all public areas, including like where you type in your credit card, you put your credit card information in. That needs to be sanitized and cleaned after every single customer. Additionally, A lot of supermarkets are already sanitizing the baskets and the carts after every single customer. You also need to be sanitizing the private employee areas. It is more likely for a worker to get the coronavirus from their own worker than the public because they're all interacting much closely together. So if one of the workers gets the coronavirus, instead of interacting with someone in the public for like 30 seconds, you're interacting with that worker over and over and over and over again. And so the more times you interact with someone with the virus, the higher probability you're going to get the virus. So you need to make sure that the employee areas and the employees are covering their nose and their mouth and taking care of their businesses. You need to offer hand sanitizing wipes for customers and your employees. If you don't have hand sanitizer and wipes, just make your own. Use paper towels, use vodka spray, use alcohol, whatever you need to do to clean as best as you can. If you don't have the 99%, use the 70%. If you don't have the 70%, use the 50%. If you don't have the 50%, use the 10%. Well, use something. Don't just not do something because you don't have the best option. Try to have a stockpile for your employees to be able to clean and take care of as much as a month. So you're going to want to have that available. You want to have the protective equipment and the cleaning supplies for your employees before you're selling them to the public, because it's the supply chain is essential to saving lives. All right, protective equipment. All employees should have gloves. All employees should have some way to cover their mouth and their nose, ideally a mask. Protective glasses are great because that also covers potential spot where you can get the virus into your eyes. Requiring all of these things is even better, right? To wear the protective masks, like if as much as 50%, 25 to 50% of all people who have the virus do not have symptoms, that means that if you have as little as 100 people to 1,000 people coming into your store per week, your workers are being exposed to the virus. Every single guideline globally, every government says that if you know that you're going to be exposed to someone with the virus, you need to wear covering protective equipment on your nose and your mouth. So basically in public areas, because of the prevalence of the virus, you just have to be covering your nose and your mouth, both so that your employees aren't giving the virus to the customers and so the customers aren't giving the virus to the employees. All the customers should be covering their nose and their mouth, but also the employees. Trust me, like, again, I said this at the beginning, I'll say it again. An elderly person who has two options: one, to come in and pack in between 7 and 8 in the morning to get their groceries, or they can come in into any time, but in a time where they do temperature checks at the front door. Everybody's wearing something over their mouth and their nose, including the workers, right? And the store limits the number of people to one person per aisle, so that you don't have to be all packed into the grocery store at the same time, and that they sanitize the credit card machine after every person. They sanitize the basket after every person. Every elderly person I have talked to would rather go into a grocery store always that has the suppression model techniques to keep everything clean and sanitized than going in between 7 and 8 o'clock in the morning to pack in there all at the same time without any of the suppression techniques, right? It's just a no-brainer. It's more healthy and better for elderly to suppress the virus and make sure that it's not going to get spread inside your grocery store than to just allow it to spread, but they can go from 7 to 8 and pack themselves in there in the morning. It's ridiculous. So let's just be smart about this and follow the models. You don't need to do every single one of these perfectly. Some of these you won't even have access to, but you do as much as you can. Also, allowing customers to pick up outdoors instead of coming indoors. The more things can be done outdoors, the better. You should still, when you're interacting with anybody at a front door or anyone, cover your nose and your mouth. It's just better to do it that way, even when you're outdoors. You need to be, what is it, like 6-10 feet from people outdoors. Indoors, it should be even bigger, even more, because the droplets can linger and the vapor can linger in the air, which is why you need to wear something on your nose and your mouth when you're indoors. if customers don't want to go indoors, they should be able to talk to someone at the front door, make an order, and then check out and then have their food at the front door, or to do online delivery pickup either way. But they shouldn't have to go inside to pick up as much as possible. Line spacing is important so that people aren't coming close to each other as far apart as you can do with your lines, both inside and outside. And ideally, you don't even have lines at all. You just give people numbers. Give people numbers, and then they take a number, and then you call their number. No lines. All right. HVAC, if you have the ability to increase the air circulation indoors, that helps tremendously because it's the stuffiness and the air just sitting around where the droplets just linger. That can have the effect of spreading the virus. And they don't know exactly how long, like whether it's minutes or hours. It doesn't really matter. The point is that people breathe, they cough, they sneeze. It lingers in the air, and then by having the air circulating through the store, you're going to reduce contamination. All right, so I think that's pretty much the business one. The evaluating the government one, I mean, it's the same sort of thing. It's just based on the plan, right? Are they initiating a recovery plan for afterwards? Are they finding locations and setting up quarantine isolation centers? Are they stopping public interaction? Are they supporting the delivery and self-quarantines? Are they setting up isolation centers with the mass testing? Are they doing mass testing? Are they setting up pandemic and fever clinics? Are they setting up drive-through clinics? Are they doing alternative testing methods if coronavirus testing isn't available? Are they immediately setting up fever checkpoints? Are they testing and tracing and tracking and treating and repeating? Are they building up subsidized expanded delivery services so that and protecting the workers who are on the front lines, who are doing the the critical support networks of food and medicine and critical needs, and making sure the supply chain doesn't collapse? Are they doing that and expanding this stability for that and ensuring that the workers are covering their mouths and their noses so that they don't get each other sick, so that the supply chain doesn't collapse? Are they recruiting? Are they doing massive recruitment and giving bonuses? Are they recruiting people to do the tracing and tracking? Are they recruiting people to build all of the infrastructure that's necessary? And again, this is across the entire world. It's not any one country. The whole world needs to be prepared for this if we're going to stop the virus. Are they ending travel unless testing is available? Are they self-quarantining immediately unless you're a frontline or triage worker? And are you organizing? Is your community organizing and allowing people to get involved? Or is it basically a special club where only the few leaders get to make all the decisions and no one else is able to say anything, right? So we're building a bottom-up approach. Everybody's welcome to be involved in the decision making, the proposals, anyone get involved. So it's all bottom-up, community, people orientated. Organizing, people-based power and organizing. So that's the questionnaire for the countries, and the idea is that if we can get one person to do a country, we need like 200 people across the world to volunteer to just evaluate the country, look at all the steps they're doing, and then just evaluate it on whether or not they are actually doing all of the different steps. Again, no country is expected to do everything, right? And some things are not mutually exclusive. You don't need to do everything. But the idea is you just kind of grade it from 0 to 9, and get a score so that we can start evaluating and comparing the different countries together so that we can see what countries are not doing what's necessary and put pressure on them and make sure that the people are the ones in control and in power, not the governments. Because if the governments aren't doing what's necessary to stop the virus, both scientifically and what's necessary for the people, then the people need to know that if we don't evaluate the countries and know whether or not they are meeting these scientific criteria points, then we won't know which countries are having these problems, and then we won't be able to fix them. So by evaluating, then you can look at the data, and then you can fix and solve the problems. And this is both for countries and businesses. So anyone who wants to help with that, we would love help on that. Okay, so let's get back to the bigger picture and close this up, we are pretty much done. Again, I thank you for watching. Join us on our conference calls. We do sessions, full moons, new moons, quarter moons, and also some other planetary sessions. And if you wonder, when the sessions are, you just search like, when is the next full moon, right? So I like Moon Giant, but basically any of these usually do the trick. So what's today? We have March 26th, so we're looking at April 7th, 10:35 p.m. So you need to make sure it's in your local time, UTC 2:35 a.m. The way that we do it is that we just cut out the minutes and we just start at the top of the hour. So if you come at 2:35, that's fine. We will be actively meeting on our conference calls and on our groups. But if you show up at 2, that's when we're going to start. We always start at the beginning of the hour just to keep it simple. We just round back to the beginning of the hour so that we are active during the actual time. So again, it's very easy to just Google and find out when and what time the sessions are based on, again, the full moons, new moons, quarter moons. These times and dates are at all times of day and night, depending on where you are in the world. Somebody has to be up in the middle of the night. This is a global response. We are trying to save lives all across the world. If you want to join us, you don't have to come in the middle of the night. You can come during the day. But I just want you to know that we do have sessions and meetings at all times of day and night, not just during the days, because we're a global network. Sweet. So conclusion. The most important thing to understand in relationship to this whole disaster is that there's a model that works. The model that works is both a localized model for specific countries, but also can be applied at a global scale. The global scale in the scaling up of this solution, the scientifically based proven solution of suppression and stopping the virus instead of mitigation, which is what Western nations are doing, is the best thing for your economy. It's the best thing for saving lives, and it's the best thing for your medical system, your supply chain, every aspect of society. There's nothing that is better to mitigate than to suppress the virus. What we can learn from this on a global scale is that if we are successfully implementing this and bringing the world together to save lives and empower people across the world, we can transform how we function and how we're able to pivot and evolve as a society to implement vision in the context of like the biggest failure right now that we can see in the world is it's a failure of imagination. We need to empower and support young new people in our global communities, possibly outside of the context of the United Nations. The United Nations is doing not much. I mean, you can go to the United Nations website on coronavirus. Let's see if they fixed anything. So UN.org. So the United Nations is doing what they can, but they're limited because they're really just an avenue internally to the governments of the world. So they don't actually United Nations website. I don't know why it's coming up. Maybe they just not even functional. Maybe. Oh, here we go. All right, COVID-19. Coronavirus global emergency. Posted broadcast image for UN staff globally. Secretary General for UNICEF New York. Huh. Life under lockdown. Practical tips. This is weird. I mean, it's like you can't even find the information that they had before. Here are some of the resource pages. Before it was even easier. Peacekeeping, human justice, environment. What is all this? That is so weird. So it looks like they made it even harder to get information on what to do to save lives. All right, they have the situation. That's so weird. So before they had a whole area where you would click on to get support for your country and to implement, you know, models for actually saving lives. But it was extremely confusing. It didn't make any sense. It was like there was endless information, and none of it was organized. It was more organized, more like a manual for like a airplane or something like that. Like it wasn't readable. No one could understand it. It was really slow. So in the description here, you can see all of our plans and all of the information that you would ever need in this. We try to make it as simple and clear as possible. Also, it's all editable, so you can change it and improve it, because we're not saying we're doing the best. We're just trying to do something instead of just sitting around doing nothing. Anyway, so now the United Nations, it doesn't even seem to have any specific information on stopping the actual or even mitigation. I don't know. Who knows? Weird. We'll have to do more research on that. But getting back to the point here, if we are successful in bringing the world together, uniting to stop this virus, we can stop it in weeks or months. If we don't stop in weeks or months, it'll continue to grow exponentially. Next thing you know, the whole world will be infected. We're looking at 200 million people dying, or mitigating, and maybe 50 million people die this year and another 50 or 100 million die next year. Or we can suppress it and only a few million people die, like 2 million. And if we suppress it immediately today, only like 700,000 would die, or a million, right? So we can do this. It's possible. It's not a happy situation, but if we do learn how to do this, there's so much applicable components to it, right? The first thing that's just obviously applicable is you can use the same scientific model that is developed in Asian countries, and if you apply it globally, if we choose to, which we don't have to choose to, but we have the science now, we can end influenza on this planet, right? The flu and all of the economic losses that are from people getting the flu all across the world can be ended in exactly the same way that we suppress and stop the coronavirus, right? You just have to create the same infrastructure for the flu, isolate people with the flu, trace, track, treat everyone with the flu, and next thing you know, it can be eradicated off this planet. We have a scientifically viable model for how to get rid of the flu. If we can also get rid of the coronavirus, the same thing. It's the same model. If you just apply what they did in South Korea to the world, you apply what they did in China to the world, we can end both the coronavirus and the flu at the same time with the same model, right? Technically speaking, you could apply it to all coronaviruses. There are like 5 of them now. So you could get rid of all the coronaviruses at the same time, and all the colds and the flu at the same time if we wanted to. We're not saying we want to do that or it's necessary. We're just saying that the science has proven it's possible. If we work together as a global society and we apply the same model within a single country as we do to the world, we can now do that. We have the technology and the ability to do that. We just have to hire a few million tracers and trackers, do a few billion tests. It's done, right? From there, we can apply that same model to the environment, into animals, into communities all across the world in relationship to the global climate crisis, right? Each component of the global climate crisis, each population group that it is affected, in that same context of it being an emergency and the level of death and the trajectory of the death, right? All the different problems in the breathing, all the different problems from the pollution, all of that can be traced and tracked. All of it can be mitigated and suppressed, and new solutions can be developed using a similar model that is global in nature, right? So if we're able to address a global pandemic and stop it in its tracks, the climate crisis, using some of the same technologies, some of the same network and strategy, can be addressed just as easily, right? Transforming our economy from a normal economy to a coronavirus economy, and then transforming it into a green and or environmentally harmonious economy where we are living in harmony and balance with the environment. Not only that will save unbelievable numbers of lives across the world and unbelievable numbers of animals' lives across the world, it will also improve our economy, and it will allow us to, evolve in a way that we are maximizing our potential as a society, especially at a global level. And there's no necessary need to just create like global government or some sort of like top down system. It can be bottom up. It can be collaborative in nature, where local communities and governments and nations all across the world can collaborate together to solve these problems, knowing that our tool chest is so much greater, that the magnitude of the ability to implement fast, swift action from before the coronavirus to afterwards is a whole new world. We now know that governments have the powers to enact massive changes in their systems when necessary, and we can apply that to other crisis points in the world and solve huge problems, including the next pandemic, right? So we know another pandemic is on the way. The more that we work in harmony with the environment, the less probability there will be another pandemic. Because one of the biggest problems of why we had this pandemic was because we were encroaching on the environment and playing around with fire, right? And not allowing the environment to be on its own and to exist on its own. And instead, we were encroaching on it, and more of the viruses and bacteria that are interacting with humanity is just not necessary, except for the fact that we keep pushing and encroaching on the environment. So the less we do that, the more we're protecting ourselves. So the last thing I'll say is that the United Nations model of governments coming together globally has failed. We now know that the Global Security Council, the global security apparatus set forth with the WHO and the World Health Organization and the um, model set up to protect this planet and all the people on this planet has failed. Right? They have a failure of imagination. They have a failure of implementation. They have a failure of education to the masses to protect people. And so we need to come together across the world and create something new that is people first, that supports people across the world, that it supports the environment across the world, that supports businesses across the world, that supports communities across the world and nations, right? But not only nations, right? A united organization that only supports nations has created a corrupt, unresponsive, and slow to act organization that gave very little community guidance and support to how to actually stop the virus, and instead allowed this mitigation model that is going to result in you know tens of millions of deaths if we don't stop it from moving forward as it is currently moving forward. So I think overall that brings a lot of hope to the world that we could create together if we choose to, or we could just sit around in our houses and just wait for someone else to fix everything, and they probably won't. And just kind of continue as usual and hand over all the power to the existing corporations and money, oil interests, and other special interests. But I would say this is a great opportunity to stop that and instead to move towards a world that is going to help people and support lives. A world where we understand that the cheapest, easiest way to supply healthcare for anybody on this planet is to supply it to everybody on this planet. Universal global healthcare is universal global security and safety for the masses, right? If we had a global healthcare system, right, it would be there would be no pandemic right now. We would already be able to stop this pandemic, right? It shows that the health and well-being of all people on this planet and the planet itself is the foundation to our security as a community, as a planetary society, right? That is the foundation. It has nothing to do with top-down government control of people or whatever. It's just basic fundamental human rights, right? And there is no cheaper way to supply healthcare to anyone on this planet instead of just doing it to everybody on this planet. Everyone deserves basic human rights and healthcare. Everyone deserves to survive the pandemic. To say that it's okay for one country to be able to stop the virus, but in other countries they basically have millions of people die, that would be not only a, a travesty and a human rights abuse. It really more of like a war crime. People should go to jail for it. But it's a failure of imagination. It's a failure of seeing the opportunity and the need to do what's right for ourselves, our own families, our own nations, and the world. Because by supporting and helping and understanding the science behind this, the only true way to stop the coronavirus is globally. It cannot be stopped in any one single place on the world. Yes, they can close down their borders and, you know, stop the spread, but the virus will still be there, right? If we want to stop the virus globally, you have to implement the strategies of the suppression models that we already know exist in Asian countries. They're proven to work, and we just implement that globally. It can be done. It is not that complicated. It will make our global economy more stable. It can be the foundation to global health access to all people on this planet, which should be a basic human right. And it can be the foundation to unimaginable wealth beyond this pandemic that can help all people in all nations across the world. So let's get to work. Let's start building something that people can believe in. Let's build something that people believe protects themselves, that their communities, that protects their societies and their families. Um, and let's do it quickly because we don't have a lot of time here. So we're meeting every full moon, every quarter moon, every other planetary sessions, new moons. You're welcome to join. You're welcome to tell us about your groups. If you're focusing on a suppression model, we want to work with you. We will come to your group. We want to build coalitions. We want everyone to collaborate together who's doing this. If you're doing mitigation, mitigation's better than nothing, but we're not really interested in that. We are interested in stopping and suppressing the virus in its tracks because there's no other scientific data we see that actually prevents the hospitals from getting overrun and potentially prevents the entire supply chain from collapsing. All right. Thank you. If you watched this whole thing, you are a rock star and are an amazing person, hopefully ready to join the global fight to stop the coronavirus. And thank you, and just good luck with your families and everyone. Take care.